Oh, Jesus. Hey, wow. Hey, so check this out. I'm going live on TikTok and I'm going live on Instagram because it was requested that I go live on Instagram because apparently I've just been abusing the people that have been on Instagram. So, with that being said, what's up, Instagram? Because Instagram is over here to my right and probably the left for y'all. But then again, I don't know how to move things around. So, yeah, we're gonna be hanging out on TikTok and on Instagram, seeing what's going on. So that way, people essentially are getting like the same information because I know a lot of people don't want TikTok. I know a lot of other people don't get on Instagram. I don't know a lot of people that get on Facebook and recreationally they hop on Facebook. But hey, here we are. So I'm just gonna give it a second, see what's going on, see who all wants to jump up on here, and then yeah, we're gonna see what's up. Happy Friday to everybody. So, hey, is it Sune? Sune. Hey, so if I start saying out your names, if you're on either one of these platforms, and if I say it wrong, sorry. But if thanks for being here. I appreciate you. Thanks for being here. Nicole said, hey, what's up? Correct. Oh, so Sune. Hey, so I pride myself on getting people's names right. So. Like a lot of times, like, hey, if I said it right, if I say, I'll give you two different ways that I say it. If I said it right, give me a thumbs up, give me a thumbs down, hit a 1, hit a 2, do whatever. So, yeah, welcome to all 4 people that are over here, 5 people now, and the 1 person that is over here on Instagram. So shout out to you, good sir. Welcome to the live. I told everybody that I was going to do this today at 5:30. So I'm trying to be consistent. I think this is the end of week 3 that I've been consistent of doing some type of live stream. So I, for one, am very proud of myself for at least doing that. So looks like we're seeing people starting to jump in. If you have never been to any of these lives before, my name is Kevin. I go by the Boot Nurse on all social media platforms, over here on Instagram, on TikTok, of course, on YouTube. Yeah, thanks for coming to hang out with me. Usually my co-host would jump up in here, but she's not in here yet. When she jumps up in here, I'll give her an introduction. She's probably cooking or dealing with the army of children that she has. And then, of course, if Heather jumps up in here, we'll talk about Heather as well. So, what is that? YBN? Hey, McFadden, what's going on? I see you, bro. I see you over there on Instagram. So yeah. Over here, we like to talk about nursing. We like to talk about NCLEX. We like to talk about essentially anything that comes to mind. Talk about a little bit of nursing news that's happened this week, and looks like there was quite a bit of some things that happened. So if you're new here, what I want to know from you is who you are, where you're from, where you're at in your nursing journey. Are you a pre-nursing student, a nursing student, about to start nursing school? Because we are in the season of starting nursing school. Have you taken your NCLEX? Have you passed your NCLEX? Do we have any nurses that are actually working in the field right now that would love to, give insight and give tidbits and all that good jazz? So yeah, those are the things that I want to know about you. If you are a brand new nurse about to start nursing school and you're looking for an NCLEX, check out the 7-day NCLEX course. The link is in my bio over here on TikTok and on Instagram. The link is in my link tree on my in my bio as well. So make sure you guys go over there and check that out. It's $48, so it's 80% off the current price. You get it forever. It's not a subscription. It's in a pre-launch phase, so it is being updated over time. So once everything is in there, you get it. So, for $48, you're going to get, over 100 plus videos. You're eventually going to be getting, NCLEX style, next generation style questions. And you're going to be getting weekly lectures from me. And if I decide to bring in other folks so they can come in there and bring their expertise as well. So, that is my little spiel. So yeah, tell me who you are. Tell me where you're from. Tell me where you are in your NCLEX journey. Hey, and by the way, if y'all are on here, y'all need to be smashing that like button. I want 1,000 likes right now. Right now. I love you. Appreciate it. So yeah, let's see what we got going on. Thunder over here said, hey, Booners, how y'all? Happy Friday. Hey, happy Friday to you as well. Army of children. Yo, look, she has an army of children. Straight up, my guy. She has an army of children. She has 4. She has 4 kids. And I'm just like, it takes a lot to be a parent, 4 kids. It's a lot. Got a lot going on. So I'm an LVN, 26-year-old, 1-year experience, long-term care, and was mentored by you. Indeed, sir. You were mentored by me. And I guess still being mentored by me as well. We've had some offline conversations about what to do next with that nursing license and, those degrees and all that good stuff, because there are many, many ways and many, many things that you can do. Either you're an LVN or LPN, or if you're an RN, you want to go be a nurse practitioner, you can. You want to go be a CRNA, you can. You want to do, quality control, infection prevention, you can. You want to be a clinical nurse coordinator, you can. You don't want to do anything healthcare related and do something non-traditional as a nurse, you can. They're looking for nurses all the time, everywhere. Trust and believe me when I tell you that. Let's see what we got. Thoughts on a second bachelor's degree, nursing. Ma'am, are you talking about getting a second degree or a second bachelor's degree and that degree is nursing? Or are you talking about, like, what do we mean? I need for you to elaborate a little bit more. Hi, my name is Nicole. I'm not in nursing, but I'm a graduate student for social work in Cincinnati. I guess the algorithm, Nicole, really just likes to send people my way in regards to it being social work, because I've had a lot of social workers in here, and I actually have a friend. She's a LCSW. And I actually gave some really good information in regards to, like, hey, she recommends this study material to help you while you're studying to get your license and all that good stuff. Because I know there's different things that you guys can do. So welcome, Nicole. I'm from Florida. What? You're from Florida? We only know there's only a few things that come from Florida. One of them, and Georgia. Fake nurse. I'm just playing. I'm just kidding. But shout out to you waiting to take my boards. Okay, so you should be getting that authorization to test here pretty soon. Clinical documentation specialist. So you're a scribe. It sounds like you're a scribe. Is that alchemismia? Look, I'm over here trying to hooked on phonics my way through this chat. Like bachelor's degree in a different field and going back for nursing. So you have a bachelor's in biology, so you're looking to get a bachelor's in nursing. Do I think you should do it? Absolutely. Why not? Why not? Go and do it. Not saying that you can't get a job with biology, or, you can't make your way through biology. But I mean, nursing, once you get your license as a nurse, like, that's probably one of the most versatile, like, degrees and licenses that you could possibly have, especially now with what's going on. Let's see. Any advice on nursing students heading into their final year of nursing school? Don't quit. Believe it or not, I've seen a lot of nurses just quit nursing school, like they're in their last semester. Be prepared. So your last year, be prepared because graduation's coming. Be prepared for those exit exams, because those exit exams are the biggest things that stop students, because if you don't pass them now, like, you don't graduate, so you got to be prepared to take those. So if they're providing ATI or HESI or Kaplan or anything like that, and you feel like it's not working, utilize other resources to help you understand whatever you're missing into, knowledge base wise. Like, is it a content thing? Is it the questions, how they're asking, so on and so forth? Be thinking about that. And remember that nursing school is an endurance race, and you're almost to the finish line of nursing school. So when you get to graduation, remember, you're not done, because you still got to pass that NCLEX. So keep nothing but positivity around you, because this last stretch is the hardest for school. All right. Let's see what's going over here on Instagram. I'm about to embark on my RN journey, and yes, the mentoring never stops. Yeah. So if I talk to you on a personal level, or even if I talk to you over here, this mentoring stuff never goes away. It's like, if I don't know the answer, I'll tell you, I don't know. And hey, maybe you should check this out. But for the most part, if you come to me with something, I'm going to give you based off of my experience, other people's experience that I've seen personally, as well as, even things that other people have gone through to, essentially kind of help you, make a better decision for yourself. Mentors never stop. Hi, HM1. Not a lot of people call me HM1. So also, obviously, for those that are new to the live, if you've never been here, I am an E6 in the Navy. I'm currently in the Navy Reserves. I've been in the Navy. Actually, next month will be 16 years. So I'm down at that home stretch. I'm doing in the reserves. And yes, I do have a bachelor's degree in nursing. And I've been a nurse for 3 years. So that's pretty much like how my life goes. And we can talk about that story a little bit later, but that ain't necessarily about me to tell right now. So it says, how would you recommend this is a reserve question. How would you recommend the reserves HM stay up with their medical skills if they don't work in a medical civilian? Okay, I see what you're saying. So how do they keep up with their medical skills if they don't have a medical job? Well, most of them you got to think is in the reserves is, do they want to do it? Some people just got put in that job, or they had a different expectation of it. So the one thing I would say is that if they want to keep up with their medical skills as a reservist, because they're part-time military, when they go in there once a month, is that they need to I would suggest getting a medical position job, like even if it's like a CNA or a medical tech or something like that in a hospital or even in a clinic or somewhere. But you and I both know that if they don't want to do it, they're not required to do it. Like their job in the military is for them to do medicine. But if they have a different desire to do like finances on the outside and that's what's working for them, that's just what's going to work for them. So my recommendation would be to tell people, hey, you can do this, or recommend to them to volunteer, because if they volunteer somewhere, it looks good on their eval for them to volunteer to doing something medical to keep their skills up as well. Also, you can also think about on the weekends when they show up, send them down to medical to do all those things as well. So hopefully that could help. Let's go over here back to TikTok. Let's see what's going on. Thanks. My friend is in nursing, just moved to Florida. Okay, any advice? Yep, already answered that. No, I validate MD's diagnosis to make sure that they meet the criteria. Lang, do you do that from home? Is that like a work from home job? Because I'm all about working from home. You know that. I got accepted to the LVN program at Galen College. Okay, and after I want to go back for my LVN to BSN. Okay, shout out to you. Shout out to you. Speaking of Galen College, I know a lot about them because I see a lot of the students walking around. I have so many questions. Well, was that BJ 1987? I hope I can answer a bunch of the questions for you. Is that Leanne? Did I say that right? Leanne? Leanne R from NC, 32 years bedside. 32 years bedside. Just reading that made my back hurt. Hey, but shout out to you for 32 years at bedside. Wow. Sitting for my ATI exit exam in 2 weeks. Any advice? Of course, study for it. And the one thing I would say is whatever areas that you're not comfortable in. This is for Katie Ryan. Whatever areas that you're not comfortable in, you need to be focusing on those a little bit more. I know that sounds really cliche and it's probably not what you want to hear, but that's the reality of it. So like for me, like pharmacology, I spent more time on pharmacology than I did on anything else. I didn't neglect everything else, but I spent more time on that because of that specific reason, to make sure I was at least, getting what I needed to get in order for me to retain it so I can pass my exam. I read all the documentations, iron out conflicting documentations with MDs. It's also coding. Okay, cool. What do you specialize in the OR? I'm in the OR as well. So Queen, I specifically worked general and GYN, and I worked with the robots. So I worked with the Da Vinci robots specifically. I actually just talked to the Da Vinci rep today, and they're always looking for people to come work, especially if you're a nurse, because who knows who does the operational aspects of messing around with that thing, other than the nurses or hell even the surge techs. So, so that's what I do. I'm using Kaplan to study for NCLEX and my scores are horrible. Okay. So if your scores are horrible, and let me tell you right now, if you're studying for the NCLEX for the very first time, or if you're a repeat test taker and you're, trying to figure out your way, your scores are going to be low. I kid you not. My first set of scores when I was restudying for the NCLEX for the fourth time, they were all low. And by low, I mean the lowest was like a 45% overall average. But then they steadily got better. By the time I got to the ninth quiz, that's when I had broke 50. By the time I got to the 15th or the 16th quiz, I broke 60. So you have to keep that consistency and you have to keep pushing through it. They're going to be horrible. They're going to be low. But you just have to fight your way through that. Now here, if you tell me that you've taken 25 quizzes and they're all low, now at some point, the trend is starting to show that there's something that you're not getting. And so it's like, what are you not getting? Or are you going through it too fast? Or are you not reading the questions? Are you not reading the answers? Do you have a content issue? Do you have, a question issue? Like, what's your environment look like? Do you got kids running around? Do you have a weird support system? Like, like a lot of those things mentally can really, really mess with you. Okay. So you really got to take a step back. This is for Jay Mackey. You got to audit yourself. You really got to audit and see like what's going on why, not why you're just not doing well, but all of the outside stuff that you have going on as well. Believe it or not, that's a huge, huge factor. Is research and transplant similar specialties? Research and research, I mean, is research. Transplant is, you can work specifically in research as a nurse, yes, and you can work in transplant as a nurse. At my hospital, we don't do transplants. We have a transplant center where they do that. Or you go to one of the bigger hospitals, or I'm sorry, you go to like a level 1 and they do that as well. So I was a labor and delivery nurse before I left bedside. Labor and delivery is its own world, Lang. That's the thing. I walk in there and I'm just like, yeah, I don't belong here. I'm just not gonna try. Not gonna try to belong here. So what is it? What do you specialize in? I think I already answered that. What do you think about Archer? I like Archer. I thought Archer was great. I've used it when I've helped coach students. So I think Archer is great. So here's the thing about reviews, even though I'm creating my own, is that, I mean, a lot of other people paved the way, and I'll tell you some ones that are really crap. As a matter of fact, I won't even mention the ones that are crappy, but I'll tell you the ones that are good, that I've heard people using, that I've personally used myself. And, yeah, Archer is a good one, especially for the price. Like, especially is because, some people can't afford all those things that are out there. I think Kaplan is probably one of the most well-known, and they're probably the most expensive. So I can work from home, but I do go into the office most of the time. Look, Lang, ma'am, respectfully, if you can stay home, just stay home. Don't go to work. You ain't got to go there. You know what I'm saying? My school is making me take ATI for NCLEX prep, and I hate it. So they're making you take ATI is because they have a contract or a racket with ATI. Trust me, when I went to school, we used HESI, and it was no better. Like, we had to pass the HESI exit exam and all this other trash in order for us to graduate. I absolutely don't like HESI at all, like at all. Hi, do you think it's necessary to get the bachelor's, or do you think RN is enough? So let me clarify some things. The RN, your RN is your license, and your bachelor's is the degree. So you can actually get your associate's degree in nursing and still get your RN, and you can get your bachelor's degree in nursing and get your RN. So that's the whole misconception that I don't like the way that schools label it, but I mean, essentially it's like, if you get your RN, if you see something that says RN to BSN, that means your associate's degree in nursing as an RN to your bachelor's degree of nursing as an RN. So, in regards to that question, this is for Martha, is that if you decide that you want to go to school, and if it's an RN program, go get do the RN program. Because what the RN program will do is it'll set you up for, if you want to go take your bachelor's, if you want to go for your bachelor's. And do I think you should go for your bachelor's? I'm all about people climbing up the ladder for themselves, because all it's going to do is just make you better. I'm at my bachelor's degree right now, and I'm working on getting my master's, but it took me like 5 years to even decide to want to do that, because I was just tired of going to school. So, but yeah, so like, and you got to think, you can start as an ADN RN nurse and just build your way up. I know people that started as janitors and now are nurse practitioners. So it all just depends on what you want. Hi, I'm here, everyone. Sasha, ain't nobody ask about you. Sasha, usually so Sasha, I don't see Sasha over here on my TikTok, so Sasha's over here on Instagram and she's harassing me. So Sasha's here, y'all. She wanted me to let y'all know. So y'all don't know who Sasha is. She's a nurse, and she's like from Florida, lives in Orlando, gives away free Disney World tickets. So if y'all want free Disney World tickets, y'all go to Sasha's Instagram and TikTok. It's Sasha_R_M. Oh, okay. My bad. I'm sorry. She told me to stop. Oh, shout out to Nurse Nelly. She's here. Hey, so there's my co-host. If you're not on TikTok, Nurse Nelly is here. Shout out to her. Make sure everybody go over there and follow her. That's my co-host. Her and I have been friends for, I think like 15 plus years. She's also a nurse, been a nurse for 4 years. And she's worked med-surg, she's worked ICU, and now she does case management. So she is one of those individuals that show that you can go from place to place to place to get, essentially to use that license and use that degree and make shit work for yourself. And now she does case management and she loves it. So y'all make sure y'all go over there and y'all talk to her. But hey, any questions that I miss, she will answer. And if Sasha was over here, she would answer them too. But I don't see her because now Sasha's just going to be my co-host on Instagram. So you know what, Sasha, you stay over here. This is where you're over here. You're banned to Instagram. So let me see. Kat said, what do you recommend for reviewing fundamentals for NCLEX? The Saunders book is good. There's a lot of YouTube channels that are out there. Of course, like Khan Academy is a good one. Simple Nursing has some good ones. Remar, Picmonic has a really good review on YouTube. It all just depends. All just depends on you, on how your pockets are. But for most fundamentals, it's like Picmonic is probably a pretty good one as well. How long have you been an RN? Is that for Talisha 99? I've been a nurse for 3 years. All read the rationales of those Kaplan questions. Oh, always read the rationales for yeah. As a matter of fact, not just for the Kaplan questions, read the rationales for all the questions, even if you get them right. I haven't been getting your notifications, ma'am. I'm going to need for you to get that taken care of. San Antonio, Texas, in the house. What was that? Anissa Walker? I don't know what that means. What does that mean? Like you live in San Antonio, Texas, and you work in your house? If you do, that is awesome. I'm trying to be like you. Do you suggest writing down rationales and every medication you don't know? There's so many. So here's the thing about medications. What you want to do is you want to know, once you understand what family that they fall under, and then you understand their suffixes, you'll know like and this is for cat, you'll know essentially like what the medication does. I'm the type of person to where I can't write down all the medications. Like there's some people that write them all down and they'll put them on flashcards and they'll do the signs and symptoms, the pharmacokinetics and all that good jazz, and they'll do that. And if that's the type of thing that you need to do for yourself, by all means, please do that. But for me, Kevin Gibson, that is not it. So I essentially studied I always use this example, like beta blockers is obviously it lowers your blood pressure. I don't know why I'm having a brain fart right now, but obviously it lowers your blood pressure. So what are the things that we check for? Of course, we want to check for blood pressure. We want to make sure that it meets the criteria for it, signs and symptoms. Most of the time, for every medication that falls under a certain family, they all have the same signs and symptoms. We need to know when to give it. We need to know when not to give it. We need to know what to look out for. If our patient is walking, another thing about pharmacology is safety. Why would I give this? Okay. Why shouldn't I give this? What if the blood pressure is normal? Do I still give it? What if the glucose is still normal? Do I still give it? What if the glucose is, and I'm just using glucose as another example. What if it's low? What do I give them? Like, what if they're unconscious? What do I give them? What if they're semi-coherent? What do I give them? So that's a lot of it, what it's about when it comes to the medication aspect. And the rationales, you don't have to write them down. Remember, it's not about, this exam is not about memorizing, or your exams are not a lot about memorizing. They're all about just being familiar. That's all it is. Let's see. It's about comprehension, picking out the critical information questions it's asking. Absolutely. I'm an associate's degree. Look, let them know. Let them know that you have your associate's degree. Start school on the 23rd. Shout out to Lakin. Lakin's here. The queen of questions. That's Lakin. Lakin is here, guys. Shout out to her. So it says 18 years. Okay, I'm here. Sasha, look. Okay, Sasha, where you at? Like, you going to be over here? You're going to be over there. I'm going to need for you to make your mind. Is it still a requirement to get the COVID vaccine? Blast 77. I'm assuming you're asking, is it okay, or is it still a requirement to get the COVID vaccine if you are in school or about to start school, or when you're going to start your job? Because I can tell you right now, at my job, it's not required for you to have the COVID vaccine. Some schools are saying that you have to have it. Do with that information. Don't start my shit. Look, Sasha, you started it, okay? Takia says 40 years retired. 40 years retired as a nurse. Shout out to you. Shout out to you and all that knowledge that you have. I'm glad that you're here. Share it. Share it with us. Kat said, thank you. You're welcome. Okay, what about this? All right, hit me with it, Kat, because I know Kat, I think Kat might take Lakin's spot as the queen of questions, and I'm okay with that. So I have a question. It says, I have a question. Which patient would you bring up in an interdisciplinary conference meeting? Okay. Go ahead. Let's see it. So, some schools are saying you need your COVID vaccine. Glad you are here too. That's okay. Okay, got you. Hey, shout out to everybody that's over here on Instagram. I don't want you guys to think that I'm abusing you, but I appreciate everybody showing up over here. Hey, for everybody who have just now shown up to both lives, I got TikTok and I got Instagram going on. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go check them out. We're talking about NCLEX. We're talking about nursing. We're talking about essentially everything that's we can talk about nursing news. We can talk about whatever. Y'all can talk about like why my hair is looking kind of frizzy or why I got like grays, fuzzies and up in here, That's life. You know what I'm saying? Y'all haven't heard my son come to the door and stick his little grimy little thingies up under here, but y'all ain't seen that yet. So, or heard him because last time we had a full-blown conversation of him babbling because, obviously he just thinks he runs the house because he's grown, right? So I want to know who you are. I want to know where you're from. I want to know where you're at in your nursing journey. For some of you guys told me. Some of you guys, I've seen you guys in here multiple times, and I appreciate that. So I want to know who you are, where you're from, where you're at in your nursing journey. Do you take the NCLEX? Are you a pre-nursing student? How many times have you taken the NCLEX? Are you currently in school? What questions do you guys have? We got tons of folks that are in here. We got somebody in here with 30 plus years of experience, somebody with 40 years of experience and retired. So I'm assuming every question that you have, we have the answers to. And if we don't, we definitely know the people who do. So, yeah, I want you guys to drop them down there. And if you're a brand new nursing student, meaning you guys are about to start school here this month or next month, or if you need help with NCLEX, period, check out the 7-day NCLEX course. If you're on Instagram, that link is in my link tree in the bio. And if you're on TikTok, that link is in the bio as well. For $48, you get it. It's there. You get it forever. It's in its pre-launch phase. So it's in its pre-launch phase. I'm saying that right now. Most of the time people don't really hear that or they don't read my website, which is also fine. That it's not complete, which means it's being updated. I actually am in the works of about 8 videos that are going to get updated, all for pharmacology. So for somebody like Kat who would ask questions about medications, those would be in there. And they're essentially separated by the families, like anticoagulants, antiplatelets, diuretics, so on and so forth. $48, you get it forever. It's not a subscription. It's just you're there forever. And then you get one live lecture that'll be popping up. And as well as you get next generation NCLEX questions. And once the course is complete, then the forever guarantee is over. So who knows how long that's going to be? Just jump up in there if you need it. And especially if you're a brand new nurse, like if you start school now, by the time you finish school, that whole thing's going to be there. And you're going to be like, hey guys, I got a $48 NCLEX course and it was great. And then everybody else is going to be like, oh my God, why? And you're just like, because I'm better than you. No, don't say that to them because they're going to get mad at you. So yeah, what's going on? Let's see. Sasha, what did you say to me? He don't care about y'all on Instagram. You a lie? Because there's people right here. I cannot. Alice said, starting my nursing next month. What advice would you give me? Be prepared to cut everybody off in your life. And I mean that in a very respectful way. Be prepared to cut everybody off because of the simple fact that nursing is going to take a lot of your time. Be prepared to put yourself on a schedule. Stay regimented to that. Because the nursing aspect is just going to be very, very different because especially when you're learning fundamentals and you're learning like health assessment and stuff, like it's very different from anything that you've done before. It was even very different for me because I had medical experience as a hospital corpsman doing those things, but it's more of the why we do these things as a nurse and how you do those things as a corpsman. Not saying that we didn't learn those things about why, it's just the overall grand scheme of things. Okay. So that's what I would say. We know you're old, sir, first of all. Wow. Okay. LPN to PA. What is the quickest way? Becca the Queen, you said LPN to PA as in like physician's assistant. PA school. That's what I would say. I need to order your course for a friend of mine. Sweet. I appreciate you. It's too long to type. Oh no. Oh, of course it is. Becca said yes. RNCCM here in case management. Hey, so I got another case manager in here. Okay. Shout out to y'all. Nursing takes all your time. That's a fact. Do you go over CPR reports if we are interested in tutoring? Nursing doesn't, Kat, this is for you. Nursing doesn't really go into CPR. We talk about doing CPR. We talk about, resuscitative things, but that doesn't really go into the reports like that. Specifically, if you're talking about like for NCLEX style questions, can you please explain having a compact license from not having one? So who is that? That's Charisse. So hold on before I answer this question. This is Kevin, just here to annoy and support you. I appreciate you. Hey, so Heather is over here on Instagram annoying me because she's great. She's one of the nurses I used to work with in the ICU, and now she just does something else, making $1,000 million more. So she does hospice now. That's what she does. Loving her life, aren't you, Heather? So I appreciate you supporting me. But yeah, so we're over here on Instagram. We're over here on TikTok. Make sure you guys share these lives with other people to see if they need them. Or if they just want to come and hang out and, shoot the shit, I'm cool with that. So with a compact license, essentially what it is you get a license in one state, which allows for you to go work in another state that have what we call the nursing licensure compact agreement, which is essentially what it's saying is that all these states agree to these criteria. So if you get a license in that state, you don't have to go to that state's board of nursing to apply for a nursing license. Now, if you're in a state like California or like Oregon or like Washington, Minnesota, Connecticut, Vermont, places like that, those are just the ones that I right off the top of my head. They require you to go through their board credentialing so you can get a license. So essentially, the compact license allows for you to go use your license that you have in your state to go work in another state without you having to apply for their license in their state. But if you do plan on living there, like relocating, it's advised that you eventually get your license changed to that specific state. Sharice, I hope that answered your question. Alice, you're welcome. Crystal, NC, 11 years, former law enforcement, master in public health, taking T's next month for ADN. Shout out to you, Crystal. Nervous about math T's. Been so long since I've taken math and chemistry. So the thing about the T's is like those are very like, standard level type of things. If you study for the T's to get into nursing school or even the HESI, you study that book for like a good month or whatever you have for like a good month, and you'll be fine. Like, the higher you get, of course, the better, because, getting into nursing school is based off of a point system or a point scale. But like, give yourself a good month and study and you'll be fine. And then I trust and believe me, no one anywhere is going to be like, hey, what'd you get on your T's? Don't nobody care. They just care for the entrance aspect of the exam. So, like after you fail, they send you a performance report. They do send you a performance report. I usually have it. I think I put it up. If you want me to show the performance report, I want 4,000 likes. There it is. There, I said it. 4,000 likes. Kat, give me 4,000 likes. That's what you're doing right now. Make it happen. Sheree said, I'm in New York. Okay, thank you. Crystal said, okay, thank you. You're welcome. Whoop. I have access to my ATI still. Can that help you with the T's? You're talking about, like, Sharice, you have access to your ATI in regards, like, your ATI for nursing school, like to pass NCLEX? Because if that's the one that you have, probably not. Let's see what's going over here on Instagram. It says, nurse tip. Get your ACLS and PALS even if you don't need it. Even if you don't need it now, it will help you transition to new positions if you're already certified. Okay, so I don't know if everybody heard that on that came from Heather. She's saying that get your ACLS and your PALS even if you don't need them when you become a nurse. Hell, even if you're not a nurse, you can get it. I think I'm pretty sure. I mean, I've gotten all my stuff medical, so I wouldn't know if it was non-medical, but I wouldn't see why not. But anyways, make sure you guys get those certifications. Because if you decide to go to your floor or you're there for 6 months or a year, a lot of other jobs are going to want to know if you have it or not. So make sure you get it. Yes, I got mine in NPR or NRP. Sharice, I really don't think that the ATI to pass your NCLEX would be feasible for the ATITs. So, yeah, wait for it. There it is. I don't know what he's crying for. Must be that time of day. He might need a nap. I don't know. But anyways, so, yeah, I'm not laughing. What are you talking about? I'm not laughing. Well, I see these likes going up, so I think I'm just going to find this thing anyway. Hold on. Hey, all right, here we go. Wow, that was really immature of me to do that. That's our baby at the door. He's not at the door. How loud does he sound? He's like in the living room or kitchen. I have an open concept of a house. So he could be by the back door and sound like he's at the front door. Why? I don't know why. That's just, he's not at the door, I promise. And he's good. He's in there. He's Gucci over there. Do you know if we have to be above passing standards if all criteria, for all the criteria in the NCLEX? So, you asked. Here it is. I didn't get the 4,000 likes, but that's okay because I grabbed it anyway. So, right here. You'll see, and this is for everybody that's on Instagram too, you'll see these sides, right? It says below, 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 above, 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 near, near, whatever, right? So to answer your question, this was not Lakin, this is for Kat. To answer your question, no, you don't have to have above everything. Because when you pass, they don't send you this. They don't send you this breakdown. Like well, that's not, well, you know what I mean. That's my degree, but they'll send, you get a license, right? And you got to think that every portion of the NCLEX is broken into 8 sections, and each section is worth a certain percentage. Top 3, all right? This is for everybody. Top 3. Got management of care, which is number 1. You have pharmacology, which is the second largest section. And then you have physiological adaptation, which is the third largest section, right? Your management of care questions will consist of, you're the nurse taking care of these patients. Who do you see first? Or if you're doing a case study, they give you a whole slew of questions, they give you everything, the paragraph, the history, the side of the labs, the trending labs, the vital signs, all that good stuff. And they're going to want to know, like, what is the first thing that you should do? Because that's how you manage care, like, from the most critical to the most stable. So now I say to you is that's why that section is large. Like, this one is from 2018. This is my first NCLEX exam that I took. So to answer your question, Kat, no, you don't have to be above the passing standard for every section. However, overall, it needs to be above the passing standard with an accumulation of all 8 sections, if that makes sense. So let's see what's up. I've seen a couple of people talk on here. I see somebody say congratulations. Congratulations to what? What happened? What's up, bro? I see you, Dave. I was on your live the other day. Not sure if you remember. Lex, I remember you. I passed my NCLEX. Thank you for your tips. You're welcome. Hey, so shout out to Lex, everybody. Everybody over here on Instagram. We got one that passed her NCLEX. She was at our live on Monday, I believe. And she told us that she was going to take her NCLEX on Wednesday. Got her results back, I'm assuming, today. So she passed. So welcome to nursing to you, Lex. Everybody give Lex some love. Show her all the love. Let her know what's up. Manifesting that. Congratulations. Congrats. Yep. Love it. How often do I do my lives? Kat, I do my lives Mondays, Wednesdays, and Fridays around between like 5:30 and 6:30. I've been really consistent by doing my lives. So, look, Lakin already telling you, Lakin's just like, I'm there for it all the time. Right. So, that's usually when I do them, but shout out to Lex. Y'all make sure y'all show Lex some love. Welcome to nursing. Welcome to the shit show. I mean, thanks for being here. Hey, speaking of being here, if you enjoy being here, make sure you guys share it. Let everybody know what's going on. Let everybody know that, I do these lives for everybody. And if you're new here, welcome. My name is Kevin. I go by the Boot Nurse. Shout out to all my co-hosts that are down here. Sasha down there doing something. Nelly down there doing something. Kat and Lakin are now the queens of questions, which I'm totally okay with. I saw Dave jump up in here. So, we're trying to foster that great nursing community for those who want to be nurses. And for all those people that are already nurses, make sure you guys check me out on all those social media platforms, to include YouTube. If you know anybody that needs this video, and if they miss it, tell them to check it out on YouTube, because I'll upload it on YouTube as well. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, pre-nursing, NCLEX, all that good jazz. I want to know it. Let me know what's up. And it's funny that we were talking about NCLEX because, of course, not just for the simple fact that I have an NCLEX review that is in its pre-launch phase. Make sure you guys go check that out. The link is in my bio for $48. But I was actually looking over some NCLEX style questions, and I kind of want to read them to y'all. If y'all want me to read them to you, I will. But I'm actually going to try to figure out a way, because I usually just do my lives. I actually do my lives from my phone, but then I just realized that I could do the lives from freaking my computer. And I can, share my screen on the computer, so I can actually pull them up. That way you can see them essentially in real time, So I think, honestly, y'all hear him crying. I think he's just really being a brat, to be honest. He's done now because he's being a brat. Okay, maybe he's not. He's doing this like pick me up. I want this. I want that. Blah, 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 blah. Yeah, y'all already know that stage. So. And our baby is screaming. Go check on him. Look, he good. He's good. He's done. He done crying. My goodness. So many mothers in here. Lord of mercy. As in you. Do you do any tutoring? My cousin is about to start a nursing program. So I don't necessarily do tutoring, but I do coaching and I do mentoring. But the coaching and the mentoring is specifically for NCLEX. that is where my heart lies and where my passion lies of, getting those to pass their NCLEX. So there's that. However, I do these lives and, hopefully those questions will get answered for anybody. So if your cousin is starting the nursing program, tell your cousin to come over here, send the link and all that good jazz. So yeah, no problem. I don't know where he could get that brat thing from, Kevin. Look, I don't even know. I don't appreciate you guys, targeting me like that. And just for that, I want 5,000 likes. Make it happen now. So let me see what I think Kat said. Kat, did you say yes to the NCLEX style questions? That's what I want to know. Instagram, how y'all doing over here? Y'all kind of quiet. I think Instagram is kind of quiet. There's nobody over here, but I'll make sure I'll put it on. That way they're both there. So I'm giving Kevin Brat. Wow. It's giving Kevin Brat moments. Wow. Okay. Okay, Kat. Well, let's see. I got a couple of questions on here. So here's a good one. And what's for dinner? I don't even know. I don't even know what's for dinner. Why? Sasha, you about to bring me a plate? Yo, I just want to let y'all know Sasha is a good cook and she's all about giving everybody a plate. Yes, we need to know. Okay. Well, I don't know. I don't know what's for dinner. Maybe whatever pops up in here. I'm just saying. All right. So I'll give you a question. I'll give you an NCLEX style question. This is for Kat, since Kat said that. So I'm going to read it. I'm going to try to not read it like I'm slow. And then we'll go through the answers together. All right. So here's the question. A client with a history of diabetes and peripheral neuropathy is admitted to the med-surg unit with a foot ulcer. Which nursing intervention should be the priority in managing the patient's foot ulcer? A, initiating antibiotic therapy to treat the infection. B, administering prescribed pain medication as needed. C, elevating the affected foot to reduce swelling. Or D, performing daily dressing changes using an aseptic technique. That's an easy one. That's an easy one. And I would show you it right here, but literally the answer's right here. So that would do you no good whatsoever. No good whatsoever. Should I answer it? Anybody can answer it. It's an open question. It's not just for Kat, by the way. For all 17 of you, there's 17 chances to get it right or wrong, whatever. No, it's not for Kat. It's for anybody. I just said the question like, hey, do you guys want me to do it? And I did it. But Kat was the one who said yes. She's the only one who responded. So, and we're going to talk about nursing news as well, because there's a bunch of craziness that came up. Okay. I'm not going to answer. Okay. If you don't want to answer, you don't got to answer. But I said that you can. My goodness. I know with the internet, there's a little bit of a lag. And I know stuff is not in real time, kind of lags it a little bit. So. You say, who says that? Is that Mara? You said C, elevating the affected foot to reduce swelling for somebody who has a foot ulcer. Like the baby thing I sent you. Oh, yeah. Y'all take y'all's time. I can reread it again. If you want me to reread it again, I'll read it again. What was the question? Okay, got you. A patient with a history of diabetes and peripheral neuropathy, those are the key ones, is admitted to the med-surg unit with a foot ulcer. Which intervention should be the priority in managing the patient's foot ulcer? Is it A, initiating antibiotic therapy to treat the infection? B, administering prescribed pain medication as needed? C, elevating the affected foot to reduce swelling? Or D, perform daily dressing changes using aseptic technique? What are the key things that are happening in there? Yeah, what are the key words? C, elevating the affected foot to reduce swelling. A, initiate antibiotics to treat the infection. Cool. It's not D. Correct. It is not D. Let's see what you guys have. So it's not. So it's D. Nope, not D. I'll tell you why. I'll tell you why it's not D. I'm not a nurse nor going to find that interesting. That's true. If you're not a nurse, you're not going to find it interesting. Most nurses don't because I mean it's just a part of it's just a part of the test. It comes with the territory, unfortunately. Wait. I wasn't choosing C. Oh, okay. Sound like you was choosing C. Thunder says A. Junior says A. Cherie says Y. The letter Y is not there, but okay. No, I'm just playing. No, you find it interesting. I got you. Cherie says A. Rohaslov says LOL. LOL is not an answer or an answer choice. So, the nursing shit show, straight up. Okay, gotta hop off. We have company. Good night, everyone. See you Monday. All right, Lakin, have fun. All right. So I think all the answers are in. So the correct answer is A, initiating antibiotic therapy to treat the infection. And I'll read my rationale. The priority in managing a foot ulcer in a patient with diabetes and peripheral neuropathy is to address any infections promptly. Diabetic foot ulcers are a high risk of becoming infected, and prompt antibiotic therapy is crucial to prevent further complications. While the other interventions are important aspects of care, treating the infection takes precedence in this situation. Anybody else have a question? I mean, anybody have any questions, thoughts, headaches about why another one's not the answer? A is the correct answer. Yes, Sasha, you are correct. I'm in law enforcement, going to get my bachelor's in health science. I want to pursue PA. Okay, shout out to you. I actually just had two of my buddies who just graduated from PA school last Friday, as a matter of fact. So it's definitely doable. Bro, wound care is my new specialty. Straight up. Infection is the key. Yes, it is. Because the key things that stick out there are diabetes and peripheral neuropathy, you know? So, and they have a foot ulcer. So the reason why they have a foot ulcer is because they can't feel the fact that they have anything going on in their lower extremities because they have diabetes. 9 times out of 10, they have uncontrolled diabetes. And, you know, that's a great thing about education, like nurse education, is to let them know, like, proper foot care. Got it. Infection. Thanks. You're welcome. Lily LPN. Got you. All right. So how'd y'all like that? Y'all want to go through another one? We can go through another one. If y'all want to go through another one, give me the 5,000 likes. That's the only reason. That's the only Sasha, you know what? Especially you. That finger better be moving, better be making it happen. All right. And make sure you guys share this live as well. So, hey, shout out to all 16 people on here. Right now, we're going over NCLEX style questions. But before I go over another question, welcome to the live. I want to know who you are, where you're from, where you're at in your nursing journey. Let us know. We got tons of nursing experience in here, and people that want to become nurses, or people that want to become PAs, or people that want to become social workers. It's all good. Like, we're a big, huge, happy family here, but the majority of the family is nurses, and that's what we're doing, and that's what we're catering to. But I love everybody. Shout out to all y'all for being here. Before we jump into that next question, though, I kind of want to talk about some crazy nursing news that I saw. There's something that just recently happened to, I believe it was like a 37-week-old baby that was in labor and delivery. I see it. 5.1. I appreciate it. Is it it's the Alabama one. Thoughts, craziness. Like, what are your thoughts? Like, let's stir up a conversation down here in the bottom. Like, I need y'all's thoughts and comments, and it's like, that's wild to me. Like, that's wild to me. All that stuff. Like how does that happen? Lindsay wants to know the story. So rather than me paraphrase it, I'm gonna bring it up. So if you guys don't follow nurse.org, I would suggest that you guys follow nurse.org. That's where I get like all my nursing news. I don't get sponsored by them. They don't, Nurse Alice doesn't pay me. Nurse Alice doesn't have me on her podcast, which I'm a little sad. I'm gonna need for y'all to go harass her so I can get on her podcast, because your boy be harassing her. So I think she blocks me. But anyways, but nurse.org, that's where I get a lot of my news from. But I am going to find the story right now, and we're going to talk about it. And then once I get finished talking about that, we'll talk about, we'll go back into the questions. But I just thought that's a really crazy thing. Like, that's a really crazy thing to just, like, how is it that, like, you're taking care of a baby during birth, and it's wild. Let me find it, because they got news stuff scattered all over the place. Let's see. We about to find it. Oh, I mean, of course, in other news, there was a lady who got caught being a nurse, got caught posing as a nurse 3 times. Like, I mean, I don't understand why, but whatever. Let's see. Where is it? Where's the story here? Let's put yeah, it was in Georgia. So the family. Oh God, with the ads. So the family, a family sues a Georgia doctor after a baby was decapitated during childbirth, like during a delivery. It says a family says a Georgia doctor used too much force and decapitated a woman's baby after it became stuck during delivery. And it was the young lady was 20 years old. And the doctor's name is Tracy St. Julian, and this is at Southern Regional Medical Center in Riverdale, Georgia. But yeah, it says where she went into labor, and that was her first child, y'all. First kid, first baby. So, hey, shout out to you on Instagram. You're welcome. I appreciate you being here. But yeah, like, pull the baby's head off. Like, I mean, I've seen, like, I was there when my son was being born. And I've seen tons and tons of, like, deliveries, but it's just like there's a lot going on there. And then so, like, it's just like you have to really be trying to, like, yank a damn baby out in order to pull a baby's head off. Like, I don't even know. Like, everyone in that hospital would die. I would set them on fire. Not on purpose. Please, TikTok, don't ban me. I don't mean it. I'm just kidding. So, but yeah, that was her first child. Oh, wow, we actually did learn about the risk of decapitation in nursing school. Yes. And you think somebody who's a medical doctor who would know better, but apparently not. Would the staff get in trouble? So ultimately, the doctor is the one who's responsible for everything that goes on in that room. Now, if the staff was telling him, like, hey, or her, like, hey, this is not right, what are you doing? And then the doctor proceeds to keep doing, then you can't necessarily be held liable unless you stop him. And if you try to physically stop him, then, I mean, not everybody's going to get in trouble, but everybody, well, the doctor is responsible for everyone and everything that goes on in that room. So I wouldn't necessarily say that the staff will get in trouble. Yo, I'm taking mom and baby right now. Look, I'm trying to tell you, fully, I don't know if it was fully detached. I didn't get all the way through. I just know that baby's head came off. So I've seen a video where the doctor did multiple maneuvers. So a lot of times it's just with mom pushing and doctor holding head to essentially gently guide baby, not like, looking like you're mooring a damn line on a damn boat trying to hook it to the fucking pier. Like, that's just not how that goes. Because we all know the largest part to get through the birth canal are the shoulders. So that's the port. Like, gotta fucking shimmy them things out. So for the fact that, like, who knows? But yeah, they show so many maneuvers. It's wild to me. It says the fact that they didn't know it was detached until they were in the funeral home. That's the crazy part. Like I said, I didn't get through the whole thing. It's just like when I saw it, it's like a lot of things I'm not trying to look at, and that was one of them. And so I thought about it right now, just as we were talking about the NCLEX style question. So starting mom and baby September 5th. Well, if you're starting mother, baby, junior on September 5th, believe this is one of those things that's just going to be brought up, and it allows for you to move a little bit more vigilantly, through labor and delivery. Like when I was doing labor and delivery, number one, I felt out of place because, I just felt out of place. I was like, man, I don't belong here. But, I made it work. It was cool. I worked in the newborn nursery, which I loved. I got all these screaming, 30-minute-old babies. One peed on me with no respect or remorse whatsoever. So I tolerated that as disrespect. And I thought, and I was ready to fight him. But it didn't happen. We called that off. So, But working in a newborn nursery was nice. You go to postpartum. Of course, you go to labor and delivery. If you possibly can go to the operating room, or if they do a C-section and all that good stuff, you can see those that happen there as well. So, but yeah, just be aware. And then, of course, I did have one time where I walked into a room, a labor and delivery, where there was, obviously there was a woman who was like 9 months pregnant, and there was like 4 different guys there. And I was just like, oh, this must be her family. But the one thing we do in nursing is that we don't assume who was in that room. So I found out that one was husband, and then the other one was like husband's brother. And then the other 2 dudes were just like, not randos, but put it this way, all 4 of them were possibly the father. And so that shit was wild to me. So anyways, labor and delivery, it's a wild space. It's a wild space. Like, it's kind of like Grey's Anatomy, but mother baby style. So you see some craziness. I've been there, but yeah, you'll do fine when you go to mother baby. Anybody not hear me? No audio? Who can hear me? Hey, if you can hear me, let me know. Let me know if you guys can hear me. Instagram, can you guys hear me? I know shoulder displacement is very dangerous. It is. It is, Krista. Oh, shout out to, hey, so Krista's here. Krista's a family of nurses. Like a whole army family of nurses. I believe you said your son just recently got his degree as a nurse, right? I believe that, Krista. We learn to allow parents to grieve with their child. Yeah, you do. That is one of the things that you do, is that you allow the patient to grieve with their child. Any questions or tips on neuro or musculoskeletal? I have a med surg exam next week. I'll get you here in a second, Lily. Wow. Same, nervous about being a guy doing labor and delivery. I can hear you. Yes, I hear you now. Okay, good. I can hear you. Brachial plexus. We are. Yeah, see, look, family of nurses. I remember that. When it comes to, this is for Lily, to answer your question. When it comes to labor and delivery, I'm not labor and delivery. Oh my God, you asked about neuro and musculoskeletal. When it comes to neuro, it's about knowing what those comorbidities are. So what issues that they have, but not only what the issues that they have is like what are the safety implications for people that have neurological issues or musculoskeletal issues. So like if you have somebody who has myasthenia gravis, like what am I thinking about that? Like how does that neurological disorder start? What does it look like at its worst? And then what are you performing? Like, are you trying to, do activities of daily living? Did they just come from surgery? Did they have a fall? Airway issues, such as like, are you feeding them? Are they at risk for aspiration? Stuff like that. Same thing with musculoskeletal. Okay. So I hope that answers your question. Let's see what else we got going on here. Okay. I got to hop off now. I'll definitely come back. Kat from Cali. Oh, you're from Cali? All right, Kat, that's cool. You can come back. No, I'm just playing. I appreciate you. How about the teenager who's saying it's the nurse's fault that the baby is dead? What does your shirt? I'm assuming you say, what does my shirt say? My shirt says the boot nurse, and it says established in 2020 because that's when I became a nurse. So that's that shirt, and you can already tell, like it's already over here fraying. It's been through a lot. You know what I'm saying? In the last 3 years, I think it's time for an update. I do got a yellow one that looks like this too. So if anybody's interested in that, you can find that on my website at thebootnurse.com and then just go up to store and it'll take you straight there. So there's that. Okay, good. Over here on Instagram, you guys can hear me. Shout out to you guys. I don't want you guys to think I'm neglecting you. But TikTok be over here, they greedy. Like Sasha over here asking me all kind of questions. Lakin was over here asking me all these questions. Like, wild over here. I appreciate y'all and I appreciate y'all. Just dropped in to say congratulations on your success, big dog. I appreciate you. We always moving over here, so I appreciate you stopping by the live. I'm going to start doing more lives over here on Instagram because a lot of people are asking for it. So that way I'm going to live on Instagram, live on TikTok. So that way everybody feels the love. Everybody hug themselves. Hug yourself and love yourself. I'm just saying. Let's help Lindsay, y'all. Hold up. Let me go back. What did Lindsay say? Pass NCLEX RN and on search for a job. Not the best at asserting myself. Interview tips and negotiating pay. Yeah, y'all help Lindsay out. Krista said, I love your videos and lives. Krista, I appreciate it. Thank you. I do these lives and these videos for y'all. Like, it's just like, I wish, not saying that these lives and these things didn't happen, but it's just like, I didn't find them until way after I became a nurse. And then I realized there was a lot of people that failed that kind of hide in a corner. So me, I'm looking to walk past people that are hiding in a corner that are feel ashamed for failing their exam. And I'm going to be like, hey, get up. Hey, get up. Because sometimes it takes people like me or other people that I had to be like, hey, get up and keep it moving. And which is why I do these lives, which is why I do these videos, which is why I created a YouTube channel, which is why I created, my NCLEX course, which is why I do my coaching. I love doing my coaching. I love doing all that stuff. So I do this for y'all, like legit. And I appreciate everybody being here. So, but Lindsay, not Lindsay, but Krista, you're the first one to have tell us they have a whole family of nurses who are actively being nurses. So that's awesome. Let's see. Let's help Lindsay. Yeah, y'all help out Lindsay. Y'all let them know what's up, or let her know what's up. One question. Hospital corpsman in the Navy is one of the good steps to start to become a nurse. Bachelor's in medicine. Yes, I would agree. I was a hospital corpsman. I'm still a hospital corpsman. It is very much right there. It is very much right there. Well, you can't see it on Instagram, but very much right there. Right? So I've been a corpsman my entire naval career, almost 16 years. I've been a surgical tech in the Navy since 2010. So you do that math. But I've been an instructor. I've taught, so many other things. And nursing or being a hospital corpsman can prepare you to be a nurse when it comes to doing the medical, aspects and at least being familiar. So with me being familiar with medicine at that level of being a hospital corpsman, it really did help me when it came to doing the skills. I picked up on health assessments really well. I almost failed fundamentals. Hey, shout out if you almost failed fundamentals, or shout out if you failed any tests in nursing school, because I failed tests in school all the time. I can tell you I failed at least one or two every semester, and I don't know how I made it through. But I did. So, but yes, being a hospital corpsman can really set you up for real. It really, really can. You failed pharm? I failed pharm too, tremendously. I failed pharm. I almost failed fundamentals. I failed pharmacology exams. I didn't fail any classes overall, but I failed so many exams. I failed not A&P, but I failed my first pharmacology exam. I failed my first med-surg exam. I failed the first 2 out of 4 fundamental exams, and no idea how I barely passed the exit. But I got an overall 78, and I needed a 75 in order for me to get out of that. In order for me to go on to the next class. So I've been there. So, but yeah, to answer your question, yes, being a corpsman can definitely put you on the right path and is a good step if you want to be a nurse. And with you actually having a bachelor's degree, I'm not sure if mechanical engineering will do it, but they have direct master degree programs you could do. They have those as well. So I'm June. Good to see you again. Nice to see you. Thank you for joining on the live. I got 3 people over here on Instagram. I got 27 people over here on TikTok. Shout out to y'all. I appreciate y'all being here. Yes, pharm exams and A&P. What it said? Nah, I failed med-surg 1, then dropped, then went back and started over in the second semester. Look, it'd be real out here. It'd be real out here trying to get through nursing school. And it's crazy to me. It's just trying to get through nursing school, and then I'm assuming everybody knows about Operation Nightingale that happened, where they had it was over 7,500 people were considered fake nurses, because their school wasn't accredited or they paid to go take the exam, and they're out here working as nurses. And I'm just hold up. Why in the hell would I ever want to work next to somebody who didn't go through the same struggles as me? Make that make sense, bro? That's a no for me, dog. I'm just saying. June, you are welcome. You are very welcome. So, but yeah, I know we talked about a couple of things. I know we talked about we talked about the decapitation of said baby, which is terrible. So, that's just life, and that's just life how it goes, and it's unfortunate. And I really hope that this family can get some type of, what's the word I'm looking for? Peace at the end in regards to that. So. Well, let's see. Why you got to bring up? Because it was in Florida and Georgia, and I lived in Florida. So I mean, Just saying. I know what goes on in Florida. And ain't nothing good. You know what I'm saying? Having a good cohort is important. Krista, I would agree with you. For most people, like, well, I'm not gonna say for most people, but for me, my cohort was all online, so it was very good for me to actually build like good relationships with the people that I was in my class with, and of course have really good study groups, which is something I also recommend. And I was part of a study group where it was like it was three other girls and it was me. And if it wasn't for those three girls, those three women, like I don't think we would have survived without one another. So I think nursing school kind of pushes you in that direction for you to work with one another, because when you become a nurse and you're out here working and doing all your stuff, you can't be out here doing it by yourself. You can't be out here doing a rogue nurse, because the moment that a code blue happens, you're going to wish that you weren't that nurse. I can tell you that right now. So yeah, having a good cohort and starting, that teamwork aspect at the beginning is extremely important. And their BS, I live out here. Yeah, I know you live out there. Chris, to that part. Yep, Kevin was up to no good in Florida. Look, you're right. I was up to no good when I was in Florida. I'm gonna need for you to not do that. This is H1G from Demertai. Seen you from the beginning. Granted, I appreciate you, man. I appreciate you. I see you out there. I appreciate you jumping on the live and letting me know what's up. I used to be there. I'm over here on Instagram. We chopping it up. You over here talking about my old command where I was before I got off active duty. So we cut from the same cloth. I know all about Demertai. I know what's up over there. I was up to no good in Florida. I mean, at the beginning. Afterwards, I kind of chilled out because I got married and everything, so it was cool. Is it true if you join the military with a BSN, you automatically become a lieutenant? That is not true. If you join with so you have to have your bachelor's degree in order to join the military as an officer. But when you join the military, they will give you lieutenant. Depending on what branch you join. So if it's the Army or if it's the Air Force, because they have the ranks of lieutenant. And the Navy has lieutenant junior grade, but lieutenant in the Navy is an 03, and a first and a second lieutenant is an 01 and an 02 in the Army and Air Force. So depending on how much experience you have as a RN will depend on what rank you get in the military. So not just automatically. If you're a brand new nurse coming out of school with a BSN, you're going to be a second lieutenant or a butter bar. And in the Navy, we call them ensigns. So it all just depends on what branch you go to and what type of lieutenant you are. So Krista says, facts. I got people asking me, did I pay for mine? I was ready to fight. That's crazy, right? It's crazy how like everybody will try to lump you in to the nonsense that's going on, in the nursing field. You're like, bro, I graduated like I fit into that criteria. You'd be like, I hope it's real. I fought for those letters. I know that's right. E5, we was lit. Look, E5 is the best rank in the entire military. I swear to you. It is the best because you're smack dab in the middle. You got somebody from up here telling you that something need to be happening. You in the middle, you about to tell somebody else what's about to be happening. So now you're middle management. It's Gucci. I loved it. I loved E5. Then I made E6, and they're just like, all I heard was H1, H1, H1. I'm just like, what y'all want, bro? Leave me alone. Anyways, so shout out to all 20 people that are hanging out here. I think we've been on this live for a little bit over an hour now. So I appreciate everybody for being here. Okay, another question. This is from Lindsay. How do you get through? Oh, imposter syndrome. Ooh. So, Lindsay, I'm going to talk about imposter syndrome right now. But what I want for you to, I actually have a TikTok that's on, it's either on, I think it's on both Instagram and TikTok, where I talked about imposter syndrome specifically. So, what I'll do is, everyone has imposter syndrome, honestly, like the first 6 months to a year, because you're going into something that is uncharted territory for you, And so the only way to get through that imposter syndrome is to be a sponge, understand where you are, understand the ins and outs of the job, mentorship, find somebody, male or female, wherever they work at in your department, and ask for guidance. Mentorship can, if you depend on the grand scheme of things, but mentorship is free. Guidance is free, especially when you're working in the hospital. It's like you want to find that nurse who is shit hot, but you also want to find that nurse that fits your personality. Like if I'm too aggressive for you, I may not be the mentor for you, or I may not be the person to guide you because maybe my abrasiveness just is too much, or maybe some people are they're just not good teachers because they're not, or some people just don't want to teach you at all. So seek out that person that has more knowledge than you, that can give you that guidance. That's actually one of the biggest things I tell people about imposter syndrome, because that's what I had. But the thing that was really crappy is that I wanted the male perspective, and I was the only guy on nights. Not only the only guy at nights, but the only black guy and black person that worked on nights on my floor when I was in the ICU. But granted, I did find two individuals that I look up to extremely that worked in the ICU. They're both nurse practitioners now. One does pulmonary, so acute care, and the other one does cardiac, and they're wonderful. Like, they're wonderful women. And with their guidance, like, one was my preceptor, the other one, preceptor, mentor, guidance, been through, her and I went through so many, code blues together. Me and, if you guys ever get the chance, she'll pop up in here every so often. She's probably asleep or about to go to work. But she goes by the emo nurse practitioner. Her name is Jana. And she'll tell you, we've been through the trenches together during the second wave of COVID. I'm trying to tell you, that shit was crazy. But her and I were cool. And I learned a lot. So that's one thing. So right now we're talking about imposter syndrome, because Lindsay was asking, how do you get through it? So to sum it all up, find those nurses that have been on the floor for a little bit, that can give you guidance, that will mentor you. Okay. Thank you to all the nurses that have served and protected us while doing a tough job. We appreciate that, Krista. A lot, sometimes the verbiage of that is just very nice to hear. Because a lot of times it doesn't feel like anybody even really remembers that. And especially administration at hospitals, they're just like, oh, okay, thanks, blah, blah, blah. Okay, bye. Or, okay, get back to work, And when you don't feel appreciated, that's when people leave. So what did Lindsay say? It said, it helps to know other nurses because experienced nurses seem so confident, but we all start somewhere. And that's another thing that really bothers me as well, is that you'll have these nurses. The one thing that I hate about any nurse is for them to turn down a student. And by turn down a student, I mean not teach a student or be rude to a student. I was a surgical tech instructor for 3.5 years, and half of that time I was a clinical instructor or clinical coordinator. So I used to have to, most of the students that I taught in the first phase, I taught in the second phase. And when people that were precepting were rude to my students, that's one thing I don't have. I'm a pit bull. The moment that I find out that somebody is being rude or disrespectful for my students, I'm coming for you. I'm going to be like, hey, so what's the problem? And then this comes out, right? And so, and with civilians who don't understand that, they're just like, whoa, why is he being so aggressive? It's kind of like the Papa Bear thing. I was just like, hey, don't do that. Don't do that. Don't do that. Don't do that to me and mine. I was like, because, and don't you ever forget where you came from, because you just walked right out of nursing school and you knew it all. You knew how to do a Foley. You weren't timid. You didn't get thrown to the fucking wolves. It wasn't trial by fire. I mean, if you were one of those people who had a very shitty situation, why would you want to continue a shitty situation for somebody else? Be better than the people that trained you. That's how you foster a better environment, when it comes to bringing up baby boot nurses. I'm being completely honest. So that's how you get through imposter syndrome. Don't let those people forget where they came from. And usually when people start talking to me like that, I remind them real quick. I don't gotta be a nurse for 3 years to remind you that you used to be a nurse at the 3rd year. You know what I'm saying? So retired nurse watching from Florida Keys. Oh, it must be real nice. It's probably nice and sunny out there. You got the water everywhere. Probably take a boat everywhere because most people don't have a car. T. Smith. So I'm just saying, shout out to you. I've never been to Key West. I always wanted to go there. But I lived in Florida. And I lived specifically in Jacksonville, and I wasn't going to drive all the way down there. So, man, it comes out hard. It does come out really hard because I'm trying to tell you that comes out. Like, don't do that. Don't do that. Don't do that to my students. So, taking my NCLEX in 11 days. Hudson, you're taking your NCLEX in 11 days. What you doing out here then? Why ain't you studying? Why ain't you studying if you got NCLEX in 11 days? What are you doing? I appreciate you being here, though. My husband always volunteers to be a preceptor, but he's going for his DMP to teach. Shout out to him. They all love him. That's great. That's great because I can tell you right now, it doesn't matter how long he's going to be a nurse, Krista, and you and I both know is that they're always going to remember him. They're like, man, I had this one awesome preceptor, and I would rather somebody remember me for the way that I teach them than anything. Like, they'll remember you more than anything. So yes, when I started, I saw nurses being nurtured on the orientation. That's good. That's how it should be. So it says, right, we're all on the team, and I find that there's a lot of ageism too. Older nurses don't like us youngins. Well, that's their own fucking fault. Maybe you shouldn't grow old. I'm just kidding. Hey, I'll just play it. Hey, give me 10,000 likes right now. I love you. So, and that's another thing too. It's just like, eventually those old nurses are going to go. Not every nurse is going to sit here and be at bedside for like this report right here says, somebody who decided to leave nurse or did 65 years of bedside. Not all nurses are going to do that. You know what I'm saying? Like, not all nurses are going to do that. And what these older nurses should want to do is treat their kids, I say kids, but you want to bring up another nurse like you would bring up a child. Because you as a preceptor, when you have a nurse that you precept, they're a direct reflection of you. And I used to say that to my surge tech students as well. And I used to say to them, I was like, hey, so don't go out there and embarrass me. Something that a parent would say, right? I was like, number one, don't go out there and embarrass me. I was like, number two, you are a direct reflection of me and how I teach you. So if you go out there and you say that you don't know something, and then they come back to me and they say, hey, they didn't know how to do this, I'm gonna be like, they lying. And then I'm gonna handle you later. Right? See, a lot of that coming out. But anyways, I'm just saying, it's like you should want to do that. You should want to take somebody under your wing and bring them up. Right? That's the whole point. That's the whole point of preceptorship and wanting to teach people. And because eventually they're going to replace you. I used to tell my surge tech students that all the time. Eventually you guys are going to replace me. Like, I'm not going to be here teaching all the time. I'm not going to be at clinicals with you. Like, I'm not going to be, working in the operating room. I'm not going to be there. So I need to know that you know what I know, even if it's a little bit more than what's being, shown to you, here at school. And most of them now, they're surge techs, they're first assists, they're licensed surgical assistants. Hell, some of them are in nursing school now. Hell, most of them still reach out to me for guidance. I'm like, man, I really hope I can give it to you. Because that's what it's about. That's what it's about. Is like, what impact can you make on them? It doesn't matter what level of medicine you're at, surge tech, medical assistant, doctor, nursing, whatever. So that was a good question. I got like 13 messages. I'm pretty sure Nurse Nelly is handling those. So shout out to everybody over here on Instagram. Shout out to y'all. We're over here on TikTok doing 2 lives. For those that are just now jumping onto the live, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check them out. YouTube, of course, Instagram, TikTok. Got a Facebook page. It's called the Boot Nation Facebook page. It's for pre-nursing students, nursing students, and nurses alike. All aspects of nursing. Because if you want to be there from the beginning, from the very beginning, for where you say something about, ooh, I want to be a nurse. And then comes to fruition, you're a nurse. And then give it, essentially, this is me giving back to those that gave to me. Like, I have books in here that have little notes that are written from mentors of mine that I hold near and dear to my heart. And I know that this is what I'm supposed to be doing, is to be here with y'all, to give y'all all that information. Shout out to my co-host, Nurse Nelly, who's down here doing her thing. And answer all these questions for me while I'm just rambling. I know we're going to do another NCLEX style question, but I want to get through these comments real quick. So, it's hot as hell. Come on, Key West. It's just hot. Yeah, you got this, Hudson. It's nice, but the heat is brutal. 119 degrees. Lord of mercy. It was like 111 here yesterday for no reason. Like, the weather is disrespectful, and I don't like it. I'm going to need for it to chill the hell out. I've been studying all day. I'm eating dinner at the mall. Okay, shout out to you. I got you. What you have for dinner? Hudson, what you eating for dinner? Got us a plate? Don't give nothing to Sasha, though, because Sasha be trying to take everybody's plate. He's 60. He doesn't act or look like it. Hey, he's aging like fine wine, Krista. That's what I'm saying. Retirement plan to teach, straight up. That's it. Like teaching, like I actually met a nurse. She had her PhD and she works at one of the colleges here and let me know about a different teaching position that they have at the college. And she said that teaching is refreshing to her. She absolutely loves it. And I was just like, that's what I want. That's what I want for myself. I started, I started psych this semester, huge psych med exam. Any tips on how to memorize or resources? Of course, anything YouTube. Khan Academy is really good. For studying psych. The biggest thing about psych is therapeutic communication skills. This is for, is it hijabi? Hijabi show. And you can check the page for sure. But for psych, it's all about good therapeutic communication skills. That is honestly what psych is all about. Krista said exactly. He wants to teach nursing students patient care one-on-one. Look, ain't nothing better than grabbing a nursing student's hand and being like, hey, come here and let me show you what's up. See, I told you. Sasha always asking for a plate. I cannot. Oh my God. Hey, y'all. So Cass is here. Nurse Cass. Hey, I just want to let y'all know that if y'all decide that y'all ever want to come for me, that Nurse Cass is my bodyguard and she will fight you. I'm just letting y'all know. Like what she got like 17 years, like in corrections. She works as a corrections nurse. She be ready to throw bows. Man, I ain't said that in a long time. That show my age a little bit. She be ready to fight. Nuck if you buck. So instantly when I saw it says, hey friend, all I hear is nuck if you buck. You know what? I think what I'm gonna do from now on, I'm gonna have nuck if you buck on standby. And so instantly when I see your name, I'm just gonna hit it. That way it's just nuck if you buck. I'm like, hey, that's your anthem. T Smith said, I need the weather to chill the hell out. I'm dying out here in this heat from the Keys. Look, and I bet you that water hot. In the Keys. I mean, it is the Caribbean, or the Caribbean or whatever, however you want to pronounce it. But I know that water hot. I know that. And look, I'm trying to tell you, in Texas, like yesterday when I got my truck, it was 111 degrees. Why? Why is it 111 degrees outside? Why? Nurses need to have the new nurses. Yep. We were all new one. That's what I'm saying. It's just like people forget. Like you forget that you used to be a brand new nurse and you didn't know nothing about nothing. That's what the name boot nurse stands for. It's like, I know nothing about nothing and I'm always going to be growing. You're always going to be growing. You're always going to learn something different. It's mostly in the aspect of nursing, but just in anything in life, you know? Let's see. Yes, in Texas is all on fire. Look, they got wildfires all over the place. The Gulf is 109. Oh, no. No. That's ridiculous. Lindsay said, okay, maybe I should move to Florida. The nurses seem more fun there. I don't know if that's sarcasm. About you moving to Florida because they're more fun there. But I mean, if you already have your license and then you move to Florida, that's cool. You ain't got to worry about somebody saying like, hey, where you get your license from? I'm just playing. I'm just messing with Sasha now. Shout out to y'all. Shout out to everybody that decided to jump onto the live. Hey, but we're going to go over an NCLEX style question. I know that specifically this was Kat that was asking for us to do this, but we'll go through one anyway. And we'll see how everybody does. Let me find it. Where did it go? All right, cool. All right, so we'll do this the same exact way. I'll read it. We'll go through the questions. We'll go through the answers, and then everybody just give me which one you think it is, and then we'll read the rationale. We'll go through it. I'm training a new nurse next week. I'm excited. What does it say? Georgia is where it's at. You know what? I'm gonna just pretend that I didn't hear you say that. I mean, I'm cool. I'm glad that you're getting a new nurse and that you're going to be training them because I know that you'll train them well. And why do I feel like the training would be like Fight Club? Cass, why do I feel like the training is going to be Fight Club? First rule about Fight Club, we don't talk about Fight Club. So you're going to be training them and then they're going to be like, how was your training? They're going to put their head down and be like, what training? Oh my God. All right, here we go. Exactly. That's what I'm saying. I'm telling you, Cash, you my bodyguard now, from now on, for the rest of your life. All right. Hey, so here we go with the question. All right. So A patient is admitted with severe dehydration and altered mental status. The healthcare provider prescribes IV fluid resuscitation. Which assessment finding should the nurse use to determine the effectiveness of fluid resuscitation? A. Increased blood pressure. B. Decreased urine output. C. A normal body temperature. Or D. Improved level of conscious. What we got? What we got? Just drop your answers down there. A, B, C, or D. And then we'll go through it. T says B. User 15 says D. Jimmy says D. What else we got? What else we got? Let's see what you got. Shout out to everybody over here on Instagram. What you got? Can you repeat the question? Lord of mercy. Okay, I will repeat the question just because you're the co-host, okay? All right. So it says, a patient is admitted with severe dehydration and altered mental status. The healthcare provider prescribes IV fluid resuscitation. Which assessment finding should the nurse use to determine the effectiveness of fluid resuscitation? A, I know you are. A, increased blood pressure. B, decreased urinary output. C, normal body temperature. Or D, improved level of conscious. Hey, look, I'm working on it, y'all. I'm working on it. I'm working on it to where I can do the lives from the computer. That way I can have the questions up. And that way we can go through them together. I see people put their camera up and start talking in the background. That's ghetto. I mean, it still gets the point across. But if I'm gonna do it, I'm gonna do it right. You know what I mean? So, yeah, go ahead and drop your answers down there. I mean, it is ghetto. So what we got? A, B, C, or D? I saw a bunch of people put D. One person put B. I could be wrong. You very well could be wrong. And that's okay. Ain't nobody gonna judge you. I mean, I might. I'm just playing. I won't judge you. I just judge you because it's you. All right, well, it looks like nobody wants to answer now. So the correct answer is D, as in dog, or delta, however you want to put it. So the correct answer is D. If a patient with severe dehydration and altered mental status, the nurse's primary concern is the improved cerebral perfusion and mental status. As fluid resuscitation progresses, an improvement of the level of consciousness is a positive indication that the intervention is effective and the patient's condition is improving. So the answer is D as in dog or in delta. Kevin Judgenass. Wow. Is that going to be my new name or what? Kevin Judgenass Gibson? That doesn't really rhyme with my middle name, but whatever. And you better not say my middle name in here. Don't do that. Don't do it. Because I know you be trying to do it. Don't you do it. This is the first, that is the first class I teach. Throw hands first, ask questions later. Look. Yo, that's hilarious. Hey, straight up. Throw hands 1-on-1. Oh my goodness. It's like, try Jesus, not me. Because you throw hands. That's what I'm talking about. I'm trying to tell you. I mean, look, Cass already knows my psych stories that I was telling people about before. And I can't do psych. I walk in there the whole time. Oh, I don't even know if I talked about the one. I don't even know if I talked about the one where there was a guy who had, was it schizophrenia? I don't know what he had going on. I think it was schizophrenia. But it was me and another girl that was out there. And he was walking around like a zombie, dragging his feet and everything. And then my man said, he looked at us. The girl was talking to him and he was laughing. Then he stopped, looked at her, pointed. He looked like one of the zombies that he stopped. And then he looked like he was going to charge her. Like some shit off I Am Legend. Oh, look, I cannot. With that, the I Am Legend, that shit gave me nightmares. I don't do zombies. But he looked at her and he was just like, you're racist. He was just like, you're racist. And she was just like, what? He's just like, you don't like black people. And I'm like, I'm standing next to her like, oh God, I didn't want to fight nobody today. I might go to jail for beating up somebody who has an issue. And she was just like, no. And she was a white lady. And she was just like, no. She was like, my husband's black and my kids are half black. And He was just like, no, they're not. Hey, when I tell you, I about lost it. Like when he said, no, they're not. Like I'm talking about laughing. Like I about lost my shit when he said that. And then he kind of looked like he was kind of steamrolling closer, and I was just like, nah, bro, we gotta go. You gotta know when you gotta go, and that was it. And so I had my fist all balled up, and I was just like, oh. See, this is why I can't do psych. This is why I can't do psych at all. I'm just saying. I haven't done that in years. I forgot you've been like, thank God. I'm glad you forgot. What was my proudest nursing moment? I've had a lot of proud, Lindsay, I've had a ton of proud nursing moments for myself, for patients, for other nurses. Like I've had a lot. Army nurses here, y'all. Shout out to you. Thanks for coming. I will say this, nursing school humbled. I will say this, nursing school humbled me. I was the last male. I was the last male surrounded by 20 plus women. Bro, that's all. I'm trying to tell you, the conversations I be sitting here listening to these women talk about, I'm like, bro, y'all are terrible. Y'all are terrible. And y'all say that men are bad? Y'all are the worst. It's just, we just shouldn't, there's just things that we shouldn't hear. It's mean and weird and gross. But, Lindsay, to answer your question, I've had a lot of proud nursing moments. Like one of my first proud nursing moments is where like we were doing, we did a code blue on somebody and we brought them back to life. And, 2 or 3 days later, they woke up and they were coherent. They don't remember the CPR or the code blue itself, but they could remember hearing people's names. Another one was where I finally understood hemodynamics, where we were talking about pressors, and the last one is where I took care of a septic patient, and hemodynamics was really like a really tough spot for me. And, I kept them stable. I kept them alive with the help of other nurses. And then to turn around when I work in the operating room and I took care of that same guy, like a couple of months later, and he didn't remember me, but his sister remembered me. And I took care of him in the operating room. And it's crazy how those things go full circle. And that was definitely a proud nursing moment. And I think they wrote like a really good ICE comment. I guess they call them ICE comments, but like really nice comments about me. And then, they sent it up to the hospital and all that good stuff. So, that was another proud nursing moment for me as well. Another one is where I was teaching one of the techs about chest tubes because I asked her to do something. And remember, I'm used to being in the military, and we teach each other how to do stuff. Hell, even the nurses would teach us something, and then we would, as a corpsman, would do it. Even if it involved doing a chest tube or doing anything, like draining it or doing whatever. But this tech didn't know anything about the chest tubes. So I took all of 5 minutes to show her, the process of what a pneumothorax was and what the purpose of a chest tube was. And she looked me dead in her face. She was like, no one has ever taught me that, nor no one has ever took the time to teach me that. And I appreciate that. And I was like, and so in my mind, I was just like, really? Like, to me, to hear that, that's foreign. Like, why would no one teach you about that? So that was another moment where, I took that time, because that's what I like to do, is to teach, to show somebody, something essentially that they didn't know. So, yeah, like it definitely comes full circle, 100%. I don't know if you guys hear him. He's laughing now. Listen. Oh, he's done. He's done laughing. He was crying, now he's laughing. There he is. Bipolar, bro. I swear, something wrong with him. I cannot with this dude. Yay, we love a full circle moment. I can't wait for that experience. That's honestly probably one of the best. What is that? Each one, teach one? Facts. Mine is when people say she was trained by Nurse Cass. Hey, straight up, when they tell you that, like, oh, Cass trained you? Oh, I ain't got nothing to worry about. I ain't got nothing to worry about. Oh, his laugh, I love it. I'm trying to tell you. He's like the community baby now. He's the boot nurse baby. I did have his picture up on Instagram, and I did have his picture up on my website a long time ago, when I was just doing coaching before I created my course. And he had a picture. I might find the picture and I might post it up here, maybe. But I did have pictures of him, and it said the boot nurse Prince, and everybody loved it. Somebody got it for him when he was born, and he wore it one day, and it was really cute. So I get it from his dada. What is laughing? I guess I do a lot of that. His giggle is super cute. Yeah, he's a terrorist. Oh God, I really got to stop saying that word for TikTok. It's just like, hey, we heard that you had the T word on your live. We're just gonna go ahead and cancel that. I'm like, oh shit. All right, my bad. Thank you. I want to see him. Know his bipolarness. Man, that's what I got these for. Oh, you can't see them. That's what I got these for. No, I'm just playing. I'm over here shaking them. It's empty. Ain't shit in it. Oh my gosh. Shout out to all 16 of y'all over here. Shout out to everybody over here on Instagram. If you're just now joining us, my name is Kevin. I go by the Boot Nurse. Follow me on all those social media platforms. If you know anybody who wants to see this and they miss it, send them over to my YouTube. It's going to be put up there. I'll probably put it up there tonight, or I'll have it up sometime this weekend so people can look at it. If you're a brand new nurse, or if you're somebody who needs to take the NCLEX again and you're looking for mentorship, check out thebootnurse.com. Go to the Boot Nurse NCLEX Mentoring and Coaching. I do offer mentoring and coaching as well. And if you're a brand new nurse about to start school and you want to get a jump on the NCLEX, at least buying it, check out the 7-day NCLEX course. Link is in the bio. It's going for $48, 80% off of the current price. Once you get it forever. That includes all 100 plus videos that I'm about to be putting up on there, as well as NCLEX style questions and weekly lectures. And I'm actually on the works of making another NCLEX review inside of the course. So got a lot coming. Like, y'all can't see my board back here. I have a whiteboard. Y'all can't see it. I'm not going to turn both phones either, but I got a lot of stuff planned for y'all. I got a lot of stuff planned for y'all. So let's go back up here. I saw somebody ask a question. Who is that? Is that Figgy? Is it Figgy or Fidgy? Fidgy. I'm trying to study for my NCLEX again after failing 3 times. Any advice on feeling discouraged? Don't. Hey, I'm telling you, Figgy, you came to the right spot, because I'm about to tell you, everybody in this comment section is about to light you up. And by light you up, I mean they are about to tell you about being discouraged. I don't coddle anybody at all. So I'm going to tell you, don't feel discouraged. I'm going to tell you to get up. I'm going to look at you and I'm going to be like, get up. All right, cool. Now it's time to walk. Now let's talk about why you aren't doing so well. Do you have this breakdown? This is for you, Figgy. Do you have this breakdown? Are you able to understand why you got below? Right? What was going on in your home life? Do you understand content? Did you recreate the testing center? Because you've been to the testing center 3 times, right? So you know what it's like. You already know the process. You can't tell me that you don't. What's your home life like? What's your support system like? Do you have children that cry and then scream? Because I do. Do you not understand the question? We went over 2 NCLEX style questions just now. Do you know how to apply your content to NCLEX style questions, right? Do you have yourself on a study schedule? Do you manage your time? Like, did you create an Excel spreadsheet and audit put your time to stuff that you do throughout the day? And then after a day or so, do you audit your time on where you can move things around to give yourself more ample time? Like, did you put forth the effort of all the things that are outside of taking the exam to help you focus on the exam? You see what I'm saying? So I'm trying to tell you, everybody in this comment section is about to light you up in a good way, though. In a good way, because this is what we're about. This is why I started this. This is why I like to talk to people. This is why I created the 7-day NCLEX course. This is why I started coaching. I failed my exam 3 times. If you don't know that, go check my YouTube. I made a whole video about it, right? You know, I do all this stuff all the time, and people will tell you. I don't coddle. I don't do any of that. But I want everybody to succeed. So think about it. Do you have any of those issues that I stated? The baby going to take over your page? He better not, Dave. He can't take over my page. I mean, if it gets me more views and more people like it, I mean, I'm kind of okay with that. But you know what I mean? Archer readiness exams. Yeah, Archer's good. T-minus 3 days. Jimmy, T-minus 3 days until what? Till you take your exam? Okay, shout out to you. I feel like hanging with y'all the past 3 Fridays is not my thing. Straight up. Like, we're going to make this a normal thing. Yep. Just change the TikTok to baby, Boot Nurse Baby. Just give him his own, right? Let's see what we got going on here. Nurse Cass is like, I have some great advice. Hey, look, drink. Are you talking about drink? Look, all right, Cass. Well, we don't want that advice if you're over here trying to drink, ma'am. Shout out to everybody over here on Instagram. I appreciate y'all coming by. There's no sugarcoating over here. Facts. You made it this far. Don't give up. There's no special timeline. You gotta be on. You will pass. Yep, straight up. So here's another thing. Here's another thing that I want to tell you guys. Like I said, I failed my NCLEX. Multiple people have failed their NCLEX. Multiple people have failed their exams and all this other stuff. But I want to tell you the difference between passing your NCLEX and conquering your NCLEX. I feel like when you pass something, it's just like passing a sign on the highway. You just drive past it and you just don't, and it's just nonchalant and it just happens. Now, when you conquer something, conquering something requires a journey. Like, you have the thought process of getting from point A to point B. I think we could all agree with that, right? So an example that I gave to somebody today is I use the military aspects of it. Though think about when there's a campaign, and a campaign means like we'll use World War II, is before they marched on Berlin, they had to go through Normandy and they had to go through other places in order for them to conquer those specific areas, right? In order for those areas to be conquered, they had to start somewhere and move their way, journey their way to that goal. I think we could all agree with that. So who's to say that the beginning of your journey is Normandy? Probably not so crazy, but the beginning of your journey is Normandy, and it's chaotic. A lot of things are happening to you at once in your first semester of nursing school. And then as you make it all the way through nursing school, and then you conquer your NCLEX, conquering your NCLEX is just like the end of we'll say the end of World War II. You know, you march on Berlin, you get the good old Adolf H word. And then after that, you know, it's conquered. You know, but it took a journey for you to get there. So think of it like that. Or you could use it as, you know, your journey of motherhood. You know, you were pregnant here, then 9 months later you had a baby, right? It took you a journey to get there. And now that journey is done for you to have conquered having a baby, now you're on another journey of raising this baby. You know, you can use that concept in any way that you want, but that is why I don't tell people to pass. I'm like, how are you going to conquer it? I failed it 3 times. At some point, you're going to be marching on this hill and people are going to be shooting down at you. Well, are you going to keep marching up that hill where people are shooting at you, or are you going to maneuver your way on a different side? You know what I mean? That's what I'm saying. Like you're gonna maneuver. Are you gonna keep going straight up, or am I gonna flank and maneuver my way up this hill? What are you gonna do? And like I said, I have to use the military aspect just because that's what I easily understand. Okay, so hopefully that makes sense to you. So this goes out to Figgy. Those are the things that you have to think about. Okay, and I know Figgy said something up here a whole second ago, so I want to read it. It says like do I start with the basics, do questions, and watch videos? Do one more than the other, like have Archer. Okay, so once again, this is for you, Figgy, is you have to put yourself on a schedule. That's the very first thing. You have to put yourself on a schedule. And you're right. Failing is not the end of the world. I also like to tell people, I was just like, if failing the NCLEX or being unsuccessful on the NCLEX is the worst thing that can happen to you today, I think that's okay. Because you're alive. You know what I'm saying? If failing the NCLEX or being unsuccessful on the NCLEX is the worst thing that could happen to you today or any day that you take it, I think that's okay. You could be in the Ukraine right now. See what I'm saying? You could be in Ukraine right now. Like, really want to give a lot of people perspective, you know, about where you are and the problems that we have. I'm not saying that those problems aren't valid, but you could have a whole different dynamic right now. You know what I mean? So think about that. But now back to you, Figgy, because now you are my main question, and I see Maddie just asked a question right here, so we'll get to that here in a second. I want to make a schedule. I'm just scared I will be putting too much energy into something unbeneficial. So how would something be unbeneficial to you if it's for you? Think about that. Think about that, Figgy. Okay. I'm in nursing school and work in the OR, anesthesia tech. I get discouraged by negative coworkers. Then the only thing I can tell you, Maddie, I work in the operating room as well. I've worked as a surgical tech as well as I work as a circulating nurse. So I can tell you right now, you're always going to have those negative coworkers. But remember, work is work. Like, as I tell people most of the time, it's just like people at work are not your friends. And people are going to be negative and discouraging because you're trying to do something better with your life. And in reality, I'm going to tell you, fuck them. Who cares? People that are not walking in the line that you are walking will always have some stupid shit to say because they're not doing it. So fuck them. Who cares? They ain't paying your bills. They ain't taking your tests. They ain't going to school. They ain't trying to better themselves. Let them do them. You see what I'm saying? So, and of course, Figgy, Take as many practice exams. You have to, and here's why I say you need to put yourself on a schedule is because in the morning, or depending on how your schedule is, like what available time do you have? Do you have 2 hours here where you can do an hour of content and then do questions and answers? Do you have 4 hours where you can do, you can do you can do an hour of content and then do, your questions and answers and then turn around and read the rationales? Like what type of learner are you? Are you visual, auditory, kinesthetic? Are you a read write? Are you a mixture of all? Like, there's a lot of things that, come into play in regards to how you're going to study, but also how you retain the information. You know what I mean? So you got to think about that. But yeah, practice exams. Obviously, I'll not talk. Practice exams, content, and start with the content that you have the most trouble with. Like I said, for me, it was pharmacology and mother baby. So I started with those pieces of content first, and then I worked my way through it, which is another reason why I created this exam. Oh, I'm sorry. Another reason why I created the NCLEX course is because no one has any direction. Like, just like you're saying, I don't know what to study. I don't know what to do here. I don't know what to do here. I don't know what to do here, which is another reason why I created it for like, hey, if you start from here and you go all the way down, I don't think you'll have a problem, because that's what I did. And I am putting the course in the order of how I study, because that's what helped me. But you can maneuver it in any way that you want. You can put it however you want. It's not doctrine. It's not law. You can change it however you want. But you need to figure out, what time you have available. Because if you're sitting here like, oh, I don't have this or I don't have that, like, you have to make that time available. You have to cut people off. There's a lot of nuances in between that you have to do. But of course, questions and answers and content, you can start there. Let's see. What's going on here? Yep, you said that. I remember someone asked why I didn't go to LVN school because I probably wouldn't get into nursing school. Yep, there's always people that say that. Like, why surround yourself with someone who doesn't believe in you? Toxic. Facts. Code Blue, be right back. Yep, there it is. Good old Code Blues. That's a great point. How do you learn? Visually, notes, by ear. Yeah, like, I'm telling you right now, I learned so much listening to audios about the NCLEX and other ways to kind of just, hear it. If I didn't have the audios, I would put the YouTube video on and listen to it while I was driving, because those are big places where I absorb content. Driving to and from work, like mowing the lawn, taking a shower, on the toilet, whatever works, whatever works for you. So that's what you have to figure out for yourself. You got to put yourself on a schedule. Figgy, I would recommend that you go into my TikToks and you look at the series. I did a series with Picmonic, and I talk about, the first thing that you need to do is that you need to manage your time. I would recommend that you go and you look at those. What specialty as a surge tech are you? I did that as well. I feel like ours specializes in cardio, ortho, and stuff. When I was a surge tech, I worked in general surgery. I was what we call I was a surgical tech in the Navy, and I specialized in general surgery. I was what they called the service senior. So I, worked with the reps. I did the sets. I did everything. I did that for a couple of years. I also deployed, and I did emergency medicine and trauma as a surgical tech. And I did that for a year in Afghanistan. Came back and I worked in oral maxillofacial surgery. So I specialized in OMS. So I did that as well. And then I became an instructor. Did that for about 3.5 years. And then, I became a nurse, and then I stopped doing things surgical tech. But my hospital, they specialize, they do a good variety of everything. So we do general GYN, urology, vascular, ortho spine, ortho, neuro, and they do like I said, they have vascular and they have hearts there as well. So Figgy, you are welcome. But yeah, I want you to definitely check those out. That, I think, by the order of how I did those videos with Picmonic, I think that could actually give you, at least a starting point for yourself. Okay. I wish you worked in the ER before applying. I wish you worked in the ER before applying to CRN school. I get that. I am totally misreading this. Let me reread this again. I wish you could work in the ER before applying to CRNA school instead of the ICU. I get why, though. So there are some CRNA schools, very, very few, that will accept people that go the ER route. But the ICU route, it's all about the drip management. And in the ER, you don't necessarily get that. I mean, you may get, you may start some levo and all the other good stuff. But in the ICU, you're doing everything, everything. And that's essentially, it's all, the biggest thing in the ICU that really translates to the CRNA aspect is the airway management, them being on a vent, and the drip management, hemodynamics, all that good stuff. The overall aspect of taking care of the patient, especially the pharmacokinetics involved with all those medications like the pressors, your muscle relaxers or your paralytics, your benzos, all that stuff. I get it too. I was going to go the ER route, but ICU route is what they want. And now almost all CRNA programs are DMP programs. So you kind of have to take that for what it is. I'm OCD. So believe it or not, flashcards actually helped because of the repetition. And that's great. And that's helpful for some people like me. I couldn't do flashcards because I don't. First of all, I would lose them. Number one. Number two is I have no idea. Like, I would put too much on a flashcard, if that makes sense. Like, some people don't put enough. Some people put way too much, and that's me for both. And then some people just put just right, and I'm just like, okay. Well, I am not the in between. I am on the left or the right. So, there's that. But I don't know if you guys hear it, but Bluey's playing in the background. And that is my favorite damn show that my son watches is Bluey. Nat, shout out to Nat for joining in on the live. I appreciate you, sir. Don't think I didn't see you just pop up in here. Don't think I didn't see you. Don't think I didn't see you, sir. As a matter of fact, I need for you to DM me, man. I got to ask you some stuff. They got some people that want some woodwork. So I'm talking to another guy. He's a guy I worked with, Corman, over there doing good stuff, part of a Marine Corps Air Wing, all that good stuff. Hey, I'm not even going to lie to you over here on TikTok, I'm telling you right now, they have a Facebook page for adults that like Bluey. I ain't saying I'm a part of it. I'm just telling you that it's there. All right. Anyways, so shout out to all 22 people that are up in here. I put too much on the I'm trying to tell you, I put way too much on I put way too much on a flashcard. And then I don't want to carry it around. To me, when I carry around flashcards, I had to wrap them in damn rubber bands. I had to do just all that stuff. And that's the crazy thing is that we're all different learners, and you have to figure out how you absorb knowledge and how you retain it. That is honestly the biggest thing is like, how do you retain it? How do I deliver it to you? Which mode of delivery do I do for you to retain it? How can I make it easy for you to understand? Right? So shout out to all y'all for being on here. I want to look at another nursing news. Let's see. Today's the 11th, right? So there's that strike that's still going on. They're still doing that. They're still doing that strike. Also, for all of my nurses that are up in here, I'm pretty sure we all know about that fire that's happening in Maui, right? In Hawaii. I hope every nurse is paying attention to that. They're going to be needing nurses. They're going to be needing nurses to go there. And so anybody that's not a nurse yet, just know that when natural disasters, if it was natural, I wouldn't be surprised on how hot it is out here, but that whole island was on fire. Like, it's wild. Like, people were jumping into the water. You see what I'm saying? She doesn't live in Hawaii anymore. Funny enough, right? But she didn't. Her family doesn't live on Maui. They live on Oahu. So, but I mean, for the most part, like, they're fine. I actually talked to her the other day. Now to bring her up. But they're gonna need nurses. Like 100%, they're gonna need nurses in Hawaii to help them out. So, there are a bunch of websites that, if anybody wants to try to be what they call a FEMA nurse or a STRAC nurse, they pay these nurses to go over there and help. Crucial is a very, very big one. And then, of course, you can go on Google and you can put like FEMA nurse, or you could put travel nurse agency. They have so many that they'll send nurses to strikes, crisis, state of emergency type deals like this. And believe it or not, the money that they would send you over here for to help with this disaster probably would be easily anywhere between $5,000 to $10,000 a week. But you're gonna be working every single day that you're gonna be there. So sometimes that money comes with all that. So as far as years of experience, what you mean, Krista? Heck no, I couldn't do a strike. Or I couldn't be a strike nurse. I'm telling you right now, there's nurses that only do strikes. They'll work PRN, 2-3 times a week. And then next thing you know, boom, they'll be like, oh, there's a strike. And they'll be gone for 2 weeks and they'll come back with a $20,000 check. And I'm just like, Some people like some some nurses mostly are women. And it's mostly women that I've heard this from. That's how they live their life. Like they wait for a strike to pop up and then they'll be gone for like 2 or 3 weeks. What's up, man? I see you made it to the live. I appreciate you, good sir. So we're over here talking about the over here on Instagram. We're over here talking about the wildfires that are happening in Maui and how some of these nurses can go over there and make them some money. Because that's exactly what they're going to want. They already said a bunch of people have died, like 55. They said right now have passed away. So they consider it's described as a war zone. So believe if you're a nurse that decides that you want to go there to help, then hey, that's what you're going to be. That's what's going to happen. You're going to be involved in taking care of that. Okay. So let's see what's going on here. Krista said, as far as his years of experience, Krista, you haven't said anything in forever. So when you said that, I was kind of lost. You can't be a strike 24/7. Yep, I'm for it. Hey, if you're for it, servant girl, go over there and do it. Look, you ain't the only nurse that would have done it, or that wouldn't have done it, if that makes sense. Could my newbie kid go? No, I would not recommend that your newbie son go. Because if he goes, Krista, if your newbie son goes to a crisis like that without having the basic nursing skills and the experience, that whole thing is going to eat him alive. It's going to tear him up. So like usually for people that are doing these strikes or it's just like the travel nursing criteria. You want to be a nurse with at least a year of experience. Right. And I can tell you right now, this right here is going to be set up like a disaster type deal, like hospitals or wherever they're going to be. They're going to be boating people off to the nearest hospital, which would be like Tripler or whatever is over there on Oahu. They'll probably be flying them off island to the United States, to California. So, there's going to be a lot of stuff that's going on. My husband was on a strike. 25 years of marriage and 3 kids. Shout out to you. 25 years. I don't know how you feel about this, but I'm 35. So you got married when I was 10, Krista. But I appreciate you being here and telling us that. And you got a whole army of nurses in your family. I love that. But I would not recommend that your son do that at all, period. Not until he gets experience under his belt. I read that it's multiple fires popping up everywhere. Yeah, and it's crazy is because, I haven't read up on it, but I don't know how it started. I don't. If anybody knows how it started, I'll probably just check it out. When my company buys out / contracts with a facility, I go help do the startup, and it's like 20 or 30K. It is like you could be there for a whole month and make like 30 grand or 40 grand. Hell, during COVID, people were making $10,000 a week and making $40,000, making more money than a doctor. I mean, there's some nurses out here that are still making way more money than a doctor, but to each their own. Servant girl said, like military. Exactly. That's exactly how it'd be. It'd be like what we call a mass casualty. When you have a mass casualty, you got your black tags, you got your yellow, you got your red, and you got your green. You better know where they're going. Ma'am, no, you didn't. Hey, look, over here on Instagram, they're over here telling me that I'm old. You're the second person today to tell me I'm old. First, it was Sasha. who told me I was old over on Instagram. Then she came over to TikTok and told me I was old over here. Now you telling me that I'm old again on Instagram. First of all, I know that I'm old. You see these gray hairs right here? I got a gray chin hair. Like right there, bro. You see it? It's glistening. You can see it real good on TikTok, but it's glistening right here. You see that? It's crazy. Wild out here. I just got in. Can you recap? Well, we started the live at 5:30 and it's now 7:30. That's all I got for you. But no, Rose, we talked about a whole bunch of stuff. We talked about we did like 2 NCLEX style questions. We talked about people that failed. We're talking about the fire right now that's happening in Maui. That's where they're going to need nurses to go. My bodyguard showed up in here and people started cheering because they know if they test me, I'm sending her after them. You know what I'm saying? So, we just out here having a good time. And if you missed it, Rose, of course, you know that just go follow me on YouTube and this is going to be up. So anything that you may have missed, you'll get out there. So, they like for seasoned nurses to go help with the startup because they can jump right in. That's true. The fire is all I need. Well, you got the fire. I just told you. Look, Nurse Nelly over here telling us that, hey, the fires are still popping up over there, like just out of nowhere. So my question is, I think I'm going to sit here afterwards and I'm going to read the article because I want to see how the fire started. I want to know how the fire started. But it wouldn't surprise me at all if the fire started just for, how it is hot as hell outside. Because here in Texas, like yesterday I posted on Instagram. Oh, hell, here we go. Sasha's back. How was your code blue, Sasha? Tell all 15 people over here on TikTok how your code blue was. Catching your breath. Hey, I'm just saying. Tell everybody how your code blue was. Rose, I want to know my next bag. I'm telling you right now, that's about to be the next bag. So if you guys don't follow all these people, if you guys don't follow like these different types of things on social media, like if it's on Instagram or on TikTok or on Facebook, like what are you really doing? I'm serious. Like crucial staffing is going to be a big one that's going to be looking out on this. Like all of them. Crucial staffing is a big one. And then, of course, they have, I think another one's like Blue Pipe, Fast Staff RN. Like they have so many nursing agencies that do that, hey, we got a crisis. We need this. And usually those things are done on a lottery because I'm talking about hundreds of thousands of nurses are going to be like, I want to go. And it's based off of lottery. So we had one a few miles from my house. It's scary. It is scary. And the thing about it is just like, if it's not controlled, Samantha, if it's not controlled, that shit's it's going to take over. It's going to take over everything. What I've seen, they haven't determined the cause. Okay. So now we don't know what the cause of the fire is in Maui. So, yeah, but we can almost just go ahead and attest that it's hot as hell. And the sun was just like, I got you. I'm just going to start setting shit ablaze. That's just what they do. Aubrey is on your live now. Oh, Lord. Hey, Aubrey. Thanks for being here. Listen here. I fight these patients, family members. They argue with us. Look, there's nothing worse than doing a code blue and then having a family member in there to witness it, because that's not only is, doing CPR and doing, physical and chemical resuscitation to a patient. Not only is it traumatic for them, it's traumatic for us that's doing it. And it's traumatic for them to watch it because they don't understand what's going on. So when they're fighting you, they're just like, you're hurting them. They don't understand that. And that shit's heartbreaking. Like, I'll be completely honest. It's heartbreaking for them to witness. And it's heartbreaking for you to have to do it because it's an instinct that you do and they have to witness it. And then sometimes you don't even realize what you're doing until it's already done. And you don't even realize that they're in there. Like that shit. I've had so many code blues where family members would be in there and their family member or the patient would code. And then you forget that they're there. You're tunnel vision at that point because all you care about is saving the patient's life. So, and trying to tell us not to touch them. They got it. I'm trying, and it. That's how they do it. Krista said, I heard that it was Hurricane Dora winds and transformers blew up. Oh, okay. I mean, that could possibly be it. Hurricane Dora. I'm talking about the Hurricane Dora winds and the transformers. Are you talking about, this is in Maui, I'm assuming, not Hawaii, right? They need to go ahead and step out. It's hard to tell people to step out. Hey, you need to get out. Like I had one guy who was talking to us and he was real cool. And then next, we started to see like they Brady down really hard. No, you did not. I'm trying to tell you a story, but patient Brady down real hard. And as we were noticed it and we were getting atropine, it was already too late. At that point, flatline. We're like, oh, and then you could hear him in the background. He's like, he was real soft. Like, is everything okay? And we like I'm doing CPR. One nurse hit the code blue. She grabs him. She's like, sir, come with me, and moves him out. And then everyone else is coming in to help me. And I'm just like, The shit is wild. And so, you have to, and like I said, it's traumatic for everybody. And a lot of people that aren't nurses don't understand how traumatic that is for us. Like we take that home and some people compartmentalize it. And at some point it's going to pop back in front of your fucking face and you're going to be like, why? And it's going to be, it's a form of, post-traumatic stress because that shit is stressful. It's stressful. They were jumping into the ocean. They actually have videos of people jumping into the ocean. It's crazy. We're literally trying to fit into the damn bathroom. Yeah. Yep. Because you got to get them out the bathroom. You got to get them flat somewhere, and you got to start doing what you need to do on the side, trying to do CPR for 10. Yep. I know it. I've been in those situations. So shout out to all 11 people that are in here. Yo, we've been on this live for 2 hours, 2 hours and 6 minutes. And y'all got me to 10,000 likes over here on freaking TikTok. I don't know how many likes I got over here on Instagram. I saw people blowing it up, but I don't know how many I got. And I'm pretty sure it'll show me after the fact. So I appreciate everybody that decided to stop by over here on Instagram. But 9 times out of 10, I will probably put up the TikTok one because it just looks better, like it's brighter. And I don't know why it doesn't look so bright. It could just be for the camera, for the fact that this is like an iPhone 7 and this is a OnePlus 7 Pro, the superior of the two. Shout out to everybody that has an Android and anybody that has an iPhone. Whatever with your iPhone and your green bubbles. Don't care. Anyways, let's see what else is going on. Don't do that. Don't roll your eyes. Okay, we're over here having a good conversation. All right, don't roll your eyes. I'm on best and still no dinner. We had to run to the ED site. That's crazy. Nelly, are you asking me why we ain't got no dinner? Like, why I ain't got no dinner? What you mean? What you mean? We could be upset. Wife doesn't love him anymore. Y'all wild. Y'all are wild and out of pocket. Okay. And if y'all really want to know, she's cooking right now. What you do to our wife? What our wife? Oh, okay. Been here for 2 hours and wifey never brought you dinner. She's cooking right now, actually. And we actually talked about that. She was just like, well, when are you going to be done with your live? And I was just like, I don't know. And then she was just like, oh, you're just here to start drama? Ma'am, don't be starting drama, okay, just because you got an iPhone, okay? And you're a slave to Tim Cook and all the iPhone zombies, okay? That goes for y'all, too. I smell bacon in there. So I don't know. But I can tell you right now. Hey, here's another thing. If y'all don't follow me on Instagram, what are you doing? I'm telling you right now because look, as soon as I get off this live, I'm taking a picture and I'm putting it on there. And if you follow me, look, as a matter of fact, I'm a tag 3 of y'all on that dinner plate. That way y'all can just be like, look, delicious. I can smell bacon in my kitchen too. Hubby is cooking. Hey, this bacon, the aroma, good to go. It's delicious, right? It's delicious. But anyways, before I get off topic, y'all make sure y'all check those out. Crucial Staffing, and then just Google a bunch of travel nurse spots for yourself because you never know if you would want to do it in the future. Okay. I need wife to hurry up because I literally saved a life and got hit. You got hit? Like somebody hit you? Oh no. Hey, if they hit you, hey, we got the goons in here. You know what I'm saying? Hey, starts with nurse and ends in 1980. She ain't about them games. Oh my God. Hey, shout out to all y'all for being up in here and being here on this Friday. I really do feel like this is just a norm. It's a norm thing that we can come up with and we could talk about. So, before I get off here, we'll talk about one more thing. We'll see what else is going on in the nursing world. Uh, Apparently, there was a nurse that was kidnapped and a child that was also kidnapped, and they were freed, and they were in Haiti. So I don't know if I want to read all into that, but they got a whole bunch of other stuff that's going on in here. Of course, anybody that's like in California, Los Angeles area, they got a whole bunch of the Dodgers Nurse Appreciation Night. So make sure you guys, nurse.org, I'm trying to tell y'all, like, that's where y'all want to go. That's where y'all want to go for all the nursing news, because all those articles are for nurses, written by nurses. So some are even LPNs I've seen on there, So there's that. Let's see. Drop the Addy. Look, hey, I'll drop the Addy. Look, you can come throw them hands with folks. I already know what's up. I'm about to start nursing school, and I'm ex-military. Why do you hear so many nurses say it's toxic? Well, Q, because a lot of things, and a lot of the traits in the nursing, not traits, but a lot of the things that happen in the nursing career field are toxic. They are, from the teaching aspect, to the hospital administrations, to the older nurses not wanting to teach the younger nurses, or for people thinking that they know more than others, people not willing to teach others. There's a lot of things. And with you being ex-military, that we have to teach one another in order for us to essentially do anything. Like, you have to train somebody in order for them to take your place, because you're going to PCS somewhere, right? So, but then afterwards, when you leave, that you train them to the best of your abilities. And at that point, it's out of your hands, right? So I'll just call you Q. So the aspects of it is very different. Like, you'll have people that have been in the same hospital for 10, 15, 20 years. And then, they see nursing students over and over and over and over. And they're just like, nah, I don't want to teach anybody anymore. Or they have shit that's going on in their own personal life, and they don't want to, you can see them wear that when they're at work, or they work too much and they don't take a vacation. It's a lot of just the negativity. There's a lot of negativity and negative traits that happen. And then another thing is just like, the different areas of nursing that you work in, some are more toxic than others. Probably the most toxic area of nursing is the ICU. Because, if like in the ICU, nursing in general, it's very, very cliquey. Nurse Nelly can give you a whole synapses of that. I can give you a whole synapses of that. Me, most of the time, I don't play that game. So, so it's like boomers versus millennials. No, it's like older. It's like, I guess you can kind of see that concept. It's like, but there's a lot. And when I say older nurses, you have nurses that have been nurses 5 years that are trying to train the new nurses. And they're just like, how do you not know that? I had a nurse that was my preceptor one time. She had been a nurse for 4 years. I had been a nurse for a year and a half at that point. But I had just started working in this new ICU, and there was something I had never experienced before. A patient. I had never had any experience before with that type of issue. And she looked me dead in my face and was like, "How do you not know that?" And I looked her in her face. I was like, "Because I've never fucking done it." She did not expect for me to say that, because it's just like you come at me with aggression, and you come at me with a stupid ass question when I already told you I've never been exposed to it. That's exactly you seriously about to get that. You're seriously about to get that. You know what I mean? So that's what a lot of the toxicity to me is like. It's like a dick measuring contest, or a whatever other measuring contest, whatever women would call it, about who knows more and who's more credentialed and who's more certified to do this. But it's like, that's what it's all about. I'm currently in heavy duty mechanics, and that's the same way. And it's not going to change. It's not going to change. You're just changing occupations, and it's exactly the same exact way. Or the older ones don't want to learn the new ways. It's like, yeah, you can't teach an old dog new tricks type thing. Yep. Or Mean Girls Club. Like, who's the best of the best? Like, why? You know what I'm saying? Like, granted, there's going to be people like, look, there was a girl who was so good at vents, but she was terrible at hemodynamics. And so, like, we would talk to each other, and she was just like, what am I doing wrong? And I'm just like, to be honest, I don't know. Everything looks good. And then we'd sit there and we'd just titrate the drips, and we try, because all it is just like, it's a balance game when you're titrating drips. Everything from propofol, Versed, if they got fentanyl, if they got Precedex, then you got pressors like Levophed, Vasopressin, Neosynephrine, like whatever you have, and then you're just kind of just playing, but then like you could have something set and then an hour later and then not work. And then you got to think of whatever else is going on with your patient. Metabolic acidosis, are their kidneys shutting down? Are they in single or multi-organ failure? Respiratory, acidosis, are they bucking the vent? Like, are they not paralyzed? Like, there's so many other aspects. But anyways, not to kind of go off on a tangent in regards to that, but the same exact way is how it is in mechanics for you. It's the same exact way on how it is in the nursing field. And I'm assuming that mechanics is mostly men. Now it's about to be completely reversed because it's mostly women. 85% women to be exact. So, but don't get it twisted. The girls are like the bros sometimes. So some of the shit I hear, just my ears, they bleed. And I, as a young man, should not have to be subjected to that. Just saying. But yeah, I really hope that answered your question, because it doesn't matter exactly where you go, it's going to be that way. Especially the ones who were there 40 years, and that's nasty. Like, look, I'm trying to tell you, yes, women are foul in so many aspects. Yes, they are. Yes, they are. You love it over here. No, I don't. I love it so much that I want to put myself in an office alone. No, but like in the overall aspect, I know a lot of people just ask me why are you a nurse? You seem like you hate it. I don't hate nursing, because nursing is not just bedside. What I don't like, I don't even necessarily hate bedside. I hate how essentially we as nurses and in the world of nursing has come to this point to where like we can be like we tolerate shittiness on all aspects, from administrators, patients, their families, providers, and other nurses. And somewhere that shit has to change. And so, I'm at the point to where I'm going to where I know that I can make an impact, and mine is at the source, which is in nursing school. So I feel like if I can foster a small amount of people that I can have an impact on to go out there to do better and to not forget where they came from, I think that's a better spot for me. So I hate trying to find placement for the patient. Look, okay. One time I was in the ICU and I had two patients. One I got transferred, and so I was first admit, and I went the whole night and didn't get a patient. It was great. That's my only time in my nursing career where I did not get an admit. It was awesome. So I sat there for 6.5 hours waiting for another patient to get admitted, and it didn't happen. It was great. Not many people can really tell that tale, and that actually happened during COVID. Not many people can tell you that. I will tell you that right now. That's what happened for me. So bedside nursing is important, because that's when shit goes awry. Yep, and complain. Dude, Aubrey is straight up tapping those hard. Hey, look. Hey, you know what, Aubrey? You can come to my lives all the time. That is just her assignment. Just like them all. Hey, because I'm just saying, the more that you like and the more that you share, the more that TikTok will push the algorithm and get more people here. So I'm just saying, I'm about to ask a question. Is it almost done? Yes. You already know what's happening right now. You already know what's happening. So with that being said, your boy is about to get off. But of course, I appreciate everybody. Don't be ugly. What do you mean? I wasn't being ugly. What did it say? Well, I need to get paid for this. I'm just trying to say. So anyways, let me not hold y'all. I'm assuming that everybody's doing some glorious things here on this Friday, but I appreciate everybody coming to both Instagram and to TikTok live to hear me essentially just run my mouth and us talk about nursing, NCLEX, for those nursing students or those nurses that are already in the field and all that good jazz. I appreciate you coming by. My last little plug, if you do not follow me on all those social media platforms, make sure you go over there to TikTok, of course, here, Instagram, and YouTube. Check out the Boot Nation Facebook page, and make sure you guys become a part of that. I love talking to pre-nursing students, nursing students, NCLEX stuff, nurses alike, because we are our community, right? and we have to help build up one another. So, and that's what I'm all about. And we are going to conquer everything that we're going to go for. If it's master's degrees, if it's BSNs, if it's NCLEX, if it's, a position at work, or if it's entrepreneurship, it's whatever. Like, hey, that's it's part of the journey, and we're going to conquer it. So, last little plug: if you know anybody that is starting nursing school and is looking for an NCLEX review or an NCLEX course that they can get the jump on, check out the 7-day NCLEX course. Instagram, it's in my link tree. And on TikTok, the link is in my bio. Make sure you guys check it out. $48, 80% off. It's going to be like that for quite some time until we're done. And then, of course, if anybody needs coaching for NCLEX, or some one-on-one, check out thebootnurse.com and then click the link where it says NCLEX Coaching and Mentoring. And you will find everything that's encompassed with that, and if that's something that you are looking for specifically. So, okay, back to studying. Thanks for the help. I appreciate it. Jimmy, I appreciate you coming by. Sasha, it's always great to have you here. So, I hope everybody has a great rest of their weekend, and I will see everybody on Monday. Bye. Let's get off. We got to go. Oh, by the way, she's making breakfast for dinner. That's why I smell bacon. Okay, bye.